Good evening, one and all. Sorry, good afternoon, one and all. Good afternoon, one and all. We welcome you to the International Conference on Human Solidarity, Good Governance, Mathematics, Solstice, Farmers' Day, Energy Conservation, Festivals, Alcohol, Drugs, Sports and Games, Environment, Pandemic, Epidemic, Endemic, Preparedness, Disasters Management, Health, Well-being and Sustainable Development 2022. Commemorating Azadi Ka Amrit Mahotsav, nation celebrating 75 years of independence, and United Nations Sustainable Development Goals, SDGs 2015 to 2030, as part awareness and campaigns, an international webinar series on holistic health, well-being and sustainable development 2022. Before we start our sessions, let's take the blessings of Almighty.
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः
With the blessings of Almighty, we shall continue to today's session. Yesterday, we also have commemorated National Dentist Day. And happy Dentist Day to everyone. And today is also Good Governance Day, commemorating our beloved Sri Atal Bihari Vajpayee ji birthday, that is Jayanti today, which is celebrated as Good Governance Day. And apart from that, we have Tulsi Puja Day. Tulsi, we know, is very auspicious plant and also has a lot of social, economical, cultural, spiritual, and even medical benefits. So it's hard to find, any house that is not with Tulsi tree. Even in COVID times, it has played a great role in saving lives also. So since ages, it has been there in every household, and it has been protecting us, everyone, from various diseases, from common cold, cough, various others. So it has been a great boon to the humankind. So today is also Tulsi Puja Divas, and also our Our Christian friends are celebrating Christmas. So Merry Christmas for all of them. So, and there are various other commemorations. So we will get into detail, each of us. Initially, we will take up session by Dr. Sonali Sarkar. She is a dentist, has over 7 years of teaching experience and over 9 years of practice in dental medicine. She would be talking today on branches in dentistry and treatment and modalities. So we welcome you, Dr. Sonali Sarkar. You can unmute yourself and start your video and continue with presentation.
Good afternoon to one and all. And I start this session by thanking all of you who are present here. And thanks for celebrating a Dentist Day, because I believe that because the patients have trust and faith in us, that's why we are actually celebrating the Dentist Day. So I'm really thankful for this, and all my gratitudes to everybody. Let us start the session today by when do we remember the dentist? Normally dentists are remembered when they have pain, when patients have pain, and that's the most commonest problem with patients. And what do we actually do? We give instant pain relief, enhance smile in them, improve function, maintain health, aesthetics, and then of course community dental health also is important, and the most important, we bring back smile in their face. And today my topic is on what are the branches in dentistry and what are the different treatment modalities. There are about basic 9 branches, and they include oral medicine, radiology, prosthodontics, conservative, endodontics, oral surgery, periodontics, pediatrics, orthodontics, oral pathology, and public health. So these are the branches. Normally, when people think it is just about just removal of the teeth or filling, that's what people think. But there are about 9 branches where we master in. And coming to conservative dentistry, when a patient has a lot of pain, as the name suggests, we conserve the teeth, that is, we preserve the area, we remove the cavities or any caries which is present and give different options. Here there are different options of fillings which are there, which is composite, which is the tooth colored filling, amalgam, which is a silver filling, porcelain fillings, and gold fillings. So according to the patient's needs, we actually place these fillings on them. Coming to endodontics, endodontics is commonly, we hear people talking about, or a dentist telling the patient that, no, you'll have to get a root canal treatment done. This root canal treatment is nothing but when the tooth gets completely infected and the infection actually reaches the root. So certain types of instruments are used to go deeper inside these root canals and clean up all the infections, and then put a filling there and place the crowns. So we could notice here, there are different types of crowns which we place. One is an all ceramic crown, which is for aesthetics. There are porcelain fused crowns with gold and porcelain fused with other metals. Coming to prosthodontics, prosthodontics is the main purpose of prosthodontics is nothing but to rehabilitate the patient. If the person doesn't have teeth, we can use partial dentures. If completely no teeth is there, then complete dentures, and implant assisted dentures, where implants are placed and on top of it, fixed dentures are used. So as you can see on this slide, um, if the complete dentures where all set of teeth are present, this is a partial denture where partially tooths are present, and this is an implant assisted dentures. Periodontics, very common. Patients come, say we have a lot of stains, we have a lot of deposits, and these deposits are normally removed with a procedure called scaling. And this here you could see are nothing but when gum disorders are there and bone loss is present, when the tooth is shaking, and we'll have to restore any type of function, then a periodontal surgery is done. And periodontics is a department where right from cleaning till gum treatments, everything is done in the periodontics department as well. Orthodontics, yes, orthodontics, there are three categories of orthodontics. One is preventive orthodontics, then orthodontics, which is for functions, and the second aesthetics, and the third one is surgical orthodontics. If a person wants to change his or his jaw positions, then it is surgical orthodontics which is done. And braces, of course, the tooth, if it is in the front or if it is too crowded, different types of orthodontics appliances are used. Orthodontics also involves functional appliances, which are nothing but habit breaking appliances, or habit breaking like thumb sucking, or all these things are used by are done by an orthodontist. And here different types of braces, you can see the metal braces. These are the ceramic braces, gold braces, and the lingual braces. Lingual braces are nothing but the braces are placed inside in the interior part of the teeth, so that outside it is not seen that people are wearing braces. And very recently, Invisaligns, which are no part of the metal is used, and different types of where it is clear and nobody can even know that orthodontic treatment has been done for this patient or is in progress to the patient. Pediatrics is a department where all the procedures regarding children, right from the time the child is born uh, till the child reaches the age of 13, a pediatrician will take care of their needs, where a cavity varnish is nothing but a preventive varnish is placed on the teeth. Uh, any caries which is there, restorative fillings are given. Scaling is nothing but cleaning the teeth. Yes, children also, when the root of the tooth is infected, undergo root canal treatments and crowns are placed. Children, habit breaking appliances are used, and space retainers are nothing but whenever there is any tooth removed prematurely because of any other problem, a space retainer is used because the second set of teeth, when they come, they need some space to come outside and they do not create any problem later on. The next department is oral medicine. That's my department because I specialized in oral medicine and radiology. And like how it is the general medicine, how a general doctor takes care uh, head to toe, oral medicine is nothing but whenever a patient opens his mouth, it's the index of the body. So oral medicine is nothing but a subject where we take care of systemic disorders, like if a diabetic, for example, a diabetic patient is there, his or her diabetic status, if it increases, and that normally affects the mouth. We can see ulcers in them, we can see bleeding gums, we can see the gums which are getting very weaker. And I would say it is almost like an index, because we can even, by looking at the mouth, we can even find out whether this person might be diabetic. So we can send them to a diabetologist to check in. This can happen for anything. It can be an hypertension patient, or cardiac patient, or a neurological disorders patient, or developmental disturbances. During the development of the child, any problem is there, we take care of it. Bone tumors, cancers, tobacco related, we call it pre-malignant lesions. So these type of diseases are actually diagnosed by an oral medicine specialist, and aiding to it are oral radiology. I have done both oral medicine and radiology, wherein CT scans, MRIs, CBCTs, all these are used to find any disorders. Like for instance, maybe the patient has cancer somewhere else in the body. but we call it a secondary tumors, which can be seen in the mouth or in the jaws, which can be present. And as a oral medicine specialist, we deal with these type of disorders, and then tobacco related disorders or neurological disorders, or patients who are having psychosomatic disorders. So all these disorders are diagnosed by an oral medicine specialist. These are the radiology. It's nothing but taking an OPG, that is a full mouth X-ray. A CBCT is for the bone as well as the X-ray for the oral cavity and the bones which are related with the upper jaw and the lower jaw. And CTs and the MRIs are also being interpreted here. An oral pathologist is a doctor, the branch where a tumor or any disorder, we take a biopsy and it is seen under the slides and under the microscope, and when while seeing in the microscope, you're able to identify what the disorder is. So that's the specialty where oral path comes in. And implantology, very recently, a lot of patients are asking, because it's very good functional, place an implant inside the jaw, leave it there, and then we can place a crown on top of it so that the functions are restored. Here, the advantage is that the patient doesn't have to remove the dentures, wash, or place it inside. It's always there 24/7 for a very long time. And laser therapy, here, yes, it's a painless, least bleeding therapy which is done. This can be done both hard tissue and soft tissue. And in patients who are very scared of dental treatments, I think laser therapies aid in reducing that pain or reducing the tension which the patient has or the stress related to dentistry. So laser dentistry has really worked very good in patients who have got a lot of anxiety for dental treatments. And oral surgery, like how surgeons are there, like for MBBS, there are surgeons who are MS surgeons like that. We have maxillofacial surgeons. It's a department where all the surgical procedures, like minor surgeries to major surgeries, are done by these surgeons. The surgical procedures as such, if a patient has a fracture or a patient wants to change his aesthetic looks or any functional, let it be the organs related, the muscle related, anything related to the head and neck region, an oral surgeon will be taking care of it. Aesthetics dentistry, someone doesn't like their teeth alignment or the color of the teeth, or they want it much more aesthetically to be seen outside, or if a patient has broken teeth, aesthetic dentistries are used where veneers can be used, crowns can be used on these type of patients. So aesthetics dentistry. Public health dentistry is a dentistry where deals with all as a community. I would say as a community, we work together, and whatever disorders related to head and neck regions are documented, are worked on it, or patients are treated in mass. For example, in India, a lot of study on dental fluorosis have been done, and a lot of patients have been got treated because of that. Or let it be tobacco-related issues where pre-malignant lesions, or the work of a public health dentist is not only to take, it's a community-based dentistry where we take all the treatment to the community into their place, which can be done. So that is public health dentistry. The awareness programs, everything is done by the public health dentist. So this, as such, in a nutshell, I have told you what are the different departments which are there and what are the other treatment modalities which are there in each and every department. And if any questions, please let me know so that I can, we can be more interactive about it. Thank you. And my wishes to everybody, Merry Christmas and a very Happy New Year.
Thank you very much, Dr. Sonali Sarkar. It was a very insightful session.
Thank you, sir.
Dear participants, if you have any queries, you can unmute yourself or you can raise your hand. and you can share your observation, queries. If you are unable to unmute yourself, you can raise your hand so that we can unmute from our side. Or you can use chat box. Generally, what kind of issues we see in community when we are dealing with community? Can you share some insights, ma'am?
Yes, sir. Actually, more I would say that tobacco-related issues, especially when it comes to children these days, and even though it is banned, but still children get tobacco products and they start using it in a very young age. And so there's so much of peer pressure, or let it be media, social media. Children think that it is okay to use tobacco related and they are aware, they're aware that yes, it is causing problems, but sometimes I think it is needed for us as doctors to make them much more aware that no, this is going to cause a lot of issues, not only in health but also in related to community. Let's say, see, when they get so addicted to tobacco, we have always noticed that let it be financially, it can be a middle class family or a low middle class family where they are, there's only some end to meet in their lives, but then still because of their addiction, economically also they go so down. Health issues also are too much. They don't know where to go and get themselves treated when they want to, or they don't. So that is when public health dentistry works in, where we are able to give awareness that no, please do not use these tobacco related uh, uh, because this can cause a lot of issues, not only health but also socially also. So I think we should all work together for it to that children do not do it in a very young age. Of course, adults also should not be doing, but it is a challenge when it comes to children.
Thank you, ma'am. And we would like to know how alcohol consumption impacts dental health and hygiene.
Yes, sir. Alcohol has this tendency to dry the mouth. It causes a lot of dehydration, which is there in the mouth. Mouth, and whenever the alcohol is consumed, there's something called glands which we have, which are two right sides. We have the parotid glands, and below we have the submandibular and the sublingual glands. So these are saliva-producing glands. When a person is actually consuming alcohol, what happens is that these glands get so dehydrated that they are not even able to produce saliva. And the most important part to cleanse our mouth is the saliva. And when the saliva reduces, what happens is that the food deposits happens more, the bacterial growth uh, becomes more. And because of this, there is a destruction in the gums, as well as it can cause a lot of caries. See, the advantage, the benefit of having saliva in our mouth is to cleanse. First important thing is to cleanse. Secondly, the saliva has a lot of antibodies by itself. So it has an antibiotic effect. So what happens when the saliva reduces, all these advantages which are there of the saliva goes away. Not able to cleanse properly, the bacteria is not able to be kept in its balanced portion. So there are other diseases, all diseases, I would say almost Even if a person is going to have alcohol with tobacco, what happens is that because of the dryingness, the tissues get much more problem when compared to synergetic effect, we say. Together also causes a more problem. When it says, so the alcohol causes a lot of other diseases. Let it be caries, let it be gum disorders, let it be tumors, it can cause anything. Alcohol is and not only about the mouth, the parotid region, it gets swelled up. Parotid is very important for us. Because of this, the patient has so many other problems which can happen.
Thank you, ma'am.
Thank you.
And this tobacco consumption and the smoking has similar effects, or we have varied effects? Can you throw some light on it? Especially those who are chain smokers, how that is going to impact their health?
Okay, there are two things, sir. There are diseases. One, when a person is smoking, the temperature inside the oral cavity actually changes. And because of this, they become one dry. One is, this is so simple. It's like a simple, even common sense, where if in case I'm going to take something burning and then I place it on my finger, it will burn. It will 100% burn. The same thing, I'm actually taking a cigarette and placing it inside the mouth, and this will actually burn the mouth. It will burn the mouth, it will burn the tissues. This happens when it is smoking. And when chewing, what happens is that a person, while chewing, he is not only going to chew it, he's just going to place it on his vestibule. We call it a vestibule, which is inside part of the cheek. And normally they place these type of tobaccos, the chewing tobaccos, between the cheek and the jaw or the teeth. So in between, when they place it, this is going to, whatever the harmful effect of the tobacco is there, is going to seep inside the tissue, and it is going to burn the tissue, and it is going to change the type of the cell which is there. So that's why we say that the normal tissues turn into malignant tissues, because there is constant irritant. We call it an irritant. There is a constant irritation which happens inside the mouth, and this can cause a lot of oral cancers. There are oral cancers. You can see a lot of hyperpigmentations which are there inside the mouth. There are other pre-malignant lesions. We call it as leukoplakia, lichen planus, or oral submucous fibrosis. We can see people who chew tobaccos are not able to open their mouth completely because their muscles have got fibrosed. Fibrosed is nothing but it has got thickened up. They're not able to function properly. They'll not be able to open their mouth. And in a longer period of time, this can get converted into the pre-malignant lesions. Conditions can get converted into cancers, oral cancers. So yes, smoking also causes a lot of problems, as well as chewing. Chewing is directly placing it inside, and the smoking happens. Yes, it happens, but it happens in a much slower pace. But both are wrong. Both are having detrimental effect on the oral cavity.
Thank you, ma'am. There is one more query. What are the causes of tooth decay? And another query is, what causes yellow teeth?
First question is, what causes decay? First is not using your dental aids properly, not brushing properly, not using flosses, not washing your mouth after eating, having sticky food. After having sticky food, people don't tend to wash their mouth. So what happens? The food which is there will remain inside the crevices of the teeth, and that will cause caries. Having a lot of drying food like this, like pets, like soft drinks, like aerated drinks, these all can make the tooth brittle, and the caries can be formed. And apart from this, when it comes to yellow teeth, one is not using your aids properly, not brushing properly, not taking care of the oral health hygiene properly. It can cause yellowness. It's nothing but a plaque. Plaque is formed like a layer on top of the teeth, but every day mechanical removal can remove that plaque which is there. But this plaque, when it hardens, if properly it is not brushed, then it becomes something called a calculus. These calculus are like deposits which have hardened up because of other constituents like calcium and all. And then what this hardened structure does, it harbors, it has these, it has this irregular surface and it can harbor a lot of bacteria in that area. So these bacteria can change into colors. It can be yellow, it can be green. So all these things can cause yellow teeth. So the best option would be brush properly after eating, gargle properly, make better choices in food, not to choose anything fast foods or any aerated drinks or any sticky foods or better choices of food could help in caries not to happen.
Thank you, ma'am. And we see generally other colors also, like we sometimes we observe different colored teeth initially, which was white. Why this coloring happens again? Not just yellow teeth, but sometimes we see orange and different kind of colors also. So, what
Yes,
could
sir.
be the reasons, ma'am?
One, it can be different types of bacteria are there, and different types of bacteria cause different types of staining. It can be that, or the patient will have bleeding gums along with the calculus. So when it bleeds up, and the blood which comes out of the gums can also change color and remain there. So the pigmentations can occur. The third thing is whatever food we consume, that can also get we use some coloring agents which are there in the food, and these can also change the color of the scalp because the calculus is already there and it can take up any color or any substance of food which is there. It will take it up. The fourth thing would be if a person has habits of smoking, then the tobacco has its brownish stains which will leave on the teeth, and that's why we see this blackish brownish colors. Sometimes, uh, if a person has hypervitaminosis, that is, some people have this habit of having too much of vitamins. There is a subscribed so much only of vitamins should be had. So these type of vitamins that they have, that can also cause the discoloration of the tooth, and even the discoloration can occur when not only vitamins, it can even occur when patients have iron, too much of iron tablets if the patient is having. So there can be brownish deposits of these iron, which is excess. It can actually deposit on the teeth and also cause discoloration. So there are varied reasons for discoloration to happen on the teeth.
Thank you, ma'am. And generally, we see certain times we see certain smell, kind of odor from mouth. What may be the reasons for that, ma'am? And how to prevent that?
It's called halitosis. Bad breath is called halitosis. Um, I would say, again, that also has different reasons. One, not brushing. Secondly, if the person has other systemic diseases, like patients, if they have gastritis, we have noticed that the patients, when they regurgitate, that is, we call it burp, and when they have gastritis and they have a lot of GI issues, what happens when they burp, they have that smell of that acid which is there. Or else, if they are diabetic, if the patient has diabetes and not controlled the diabetes, the ketone, which we call it as a ketone smell, you can actually know from the type of smell from the patient's mouth that this person might have diabetes also. Okay, so anything which is related to the whole body can actually be known as bad breath. It's not necessary that this bad breath should be only because of not brushing properly. Not necessary. Maybe they have other problems in their body which is manifesting, or they are signs. We say signs that okay, this person might have diabetes, or maybe this person might have gastrointestinal issues. So, so it all depends. Um, the patient cannot treat himself by himself for bad breaths in these type of problems. But if it is because of oral hygiene issues, then we will tell the patient that please brush, use mouthwashes, all these things we can give. But if it is related to any systemic disease, it's always better to get it checked whether they are having other issues. So that is when we tell the patient to go to a general physician or to a specialized doctor, and they can treat. If an underlying issue is treated, then this bad breath will go away.
Thank you, ma'am. We also see these a kind of scaling that happens on the teeth, like a sedimentary deposit, or even I think that sometimes the teeth also get corroded, or maybe I'm not aware of exact term, but why this happens
So this
under
is called,
period.
this is actually called calculus. I told you, no, the plaque which is there on the tooth surface, if it is not mechanically brushed every day, and we just leave it and the food, whatever food we are eating gets deposited again and again and again in that area. So when this happens, it gets calcified. That is, it becomes much more thicker, and it becomes like a scale which is there on top of the on top of the tooth. It will look yellow, it will look brown, it will look more thicker, which is there. So this can harbor a lot of bacteria on top of it. Mechanically, a patient cannot remove calculus. 100% dental professionals only can remove these calculus through a procedure called scaling. And if this calculus is quite deep inside the root surface, then we do something called as deep scaling and remove the calculus, which we call it supragingival and subgingival. Supragingival is nothing but above the gums. Whatever we see outside is above the gums. Inside the gums also, these deposits can happen, and this can be removed only by dental professionals by a procedure called scaling or deep scaling.
Thank you, ma'am. And in some people, we see they are too sensitive to hot or cold items like ice creams, or sometimes when they eat certain food items, they feel pain. So, how do we know that certain food items are, harmful for our teeth, or they are very sensitive to it, and how to avoid? Or in general, there are any such foods which we have to avoid for dental health? Can you give insights into that?
Yes, sir. Actually, our tooth on top is covered with enamel. Okay. Enamel is the hardest part in our body. And this enamel, it gets corroded, or it becomes, we call it untreated, or it can be abrasion or anything, can cause sensitivity. So when this enamel thins out, the nerve endings which are there is in a structure called dentin, which is below the enamel, and this gets exposed. When this gets exposed, sensitivity occurs. This can even then progress to pain. This can be because this can happen, that is, the enamel can get corroded. First, improper brushing. That is, some people brush so hard that they remove away the enamel at all. Fully, totally, they'll remove it by themselves by mechanical brushing in a very wrong manner. They are not brushing it in a wrong manner, or they are not using the right brush. All these things can corrode the enamel. Secondly, food which you said, like uh, uh, like these soft drinks, especially aerated drinks. These aerated drinks can also be a detrimental effect on the teeth structure, especially the enamel. The third one will be, some people will have systemic disorders like acidity. If you could notice, people have acidity and they'll be burping again and again, and they'll be bringing the acid from the stomach to the mouth. And this acids, what happens is that it also removes away the enamel which is there in the mouth. So that when it comes to food, why I'm stressing food, certain things, acidity causing foods also should be avoided. Not only talking about from outside, whatever causes acidity. Like improper food habits, having too much of spicy food, having too much of hot food, spice, especially spice, a lot of spice food which we have, which will trigger acidity, or not eating food at all. Some people even don't eat food properly, that they form acidity. Like they can have peptic ulcers. So all these things also can be. So I wouldn't say that it is only such and such food should be had. Any food which it should be had in the right manner, right time, right manner. No spicy food. Have a lot of fiber foods. Um, uh, Nothing much too much hot, nothing much too much spicy, no alcohol, no tobacco. uh, all these things should be avoided, because acidity also can cause these type of sensitivity. We call it erosion. When the enamel gets eroded, what happens is that these nerve endings are outside, and this can actually cause a lot of sensitivity. So from patient's point of view, right food should be had.
So in such cases where due to hard brushing or in similar cases, if any patient loses his or her enamel, ma'am, then what would be the remedy or treatment for that?
Yes, sir. It can be from veneers, it can be fillings. If it is too much eroded, then go for a root canal and put a crown on top of the tooth. If in case a lot of tooths have been sensitivity, desensitizing toothpaste can be given so that they don't get a lot of sensitivity which happens. These are the treatment modalities which can be given according to the patient's problem. See, mild problems, we give desensitizing paste. But if it is progressing, as I'm saying, desensitizing paste, then the next part would be, if the enamel is too much gone, then a filling can be done. A filling, composite fillings can be done, or GIC fillings can be done. If no, it is much more deeper, then it has almost touched the dentin and the pulpal region, then we get a root canal done for this patient and put a crown there, so that we can protect that tooth. The patient doesn't get sensitivity after that. These are the treatment options which are there for it. But still, diagnosis has to be done, what type of erosion or attrition or abrasion has occurred in these patients. There's one more thing. Children have this habit of grinding their teeth. In sleep, they will grind their teeth. Or adult also, when they're very stressful or they are anxious state, in sleep they'll be clenching their teeth, and it's called bruxism. So this also can mechanically, without even the patient knowing, they will be grinding their teeth in the night. People who are sleeping next to them will always tell them that you're grinding teeth, I can actually listen to what you're doing. And they are actually very anxious in their own. And these type of patients, we give them something called a soft splint. We'll place soft splints on top and the upper and the lower teeth. And when they are sleeping, they have to wear it so that there is much more, they do not grind it more. And that will not cause more pressure on the muscles when they are grinding it unknowingly. They are not knowing it. And subconsciously, they are doing it, and they are not knowing it that they are doing it. So that also can cause attritions in these patients, and we give them a soft splint for that. And we even give them muscle relaxant so that they relax a bit.
Thank you, ma'am. And sometimes we feel a very sharp teeth. Sometimes it automatically goes off. Like, but we know that after certain age the teeth doesn't grow. So why this kind of this thing happens? Sometimes it becomes sharp, and sometimes it is like normal. Why this kind of sensation happens, and how to prevent this?
Sir, if it has become sharp, as I said, that because of maybe the tooth has a caries, and a part of the tooth is totally gone, and there is sharpness, or maybe the tooth is broken, and there is sharpness in the teeth. So all these things, the patient cannot do anything. Only the doctor has to smoothen that areas. One, treat that whatever problem is there, treat that issue, and then remove that whatever sharp tooth is there. We call it as coronoplasty. That is the area where it is sharp, we will reduce it and smoothen it off so that it doesn't hurt any other tissues, or while talking, the tongue might get hurt or the cheek might get hurt. So because of this, we do this procedure called coronoplasty. But if as I said, attrition or abrasion, or if there is an erosion and only a part of the tooth is there, and that can also cause it. So only dental professionals can, I think I'll smoothen that area, and then after that the patient will not have a problem.
Thank you, ma'am. And nowadays we see, many people, even normal people are also using these electronic brushes. So how do you see, and if it is safe to use these electronic brushes by normal population, or how do you see this, ma'am?
I personally think that it's not necessary. Normal people have a good amount of they can brush by themselves. Maybe these electronic brushes actually had come for special children or geriatric patients where their coordination of the muscle was not there and they couldn't hold their brushes properly or brush. And these type of patients, only earlier these type of toothbrushes were used. That is the automated toothbrushes. That is the electronic toothbrushes. There's something called trend. People tend to think that if I use an automated toothbrush, I am in trend. I'm in vogue. I actually show my peer that, see, I'm using the most latest equipment. I have the money to actually buy that, and I'm using it, and I see how uh, high technology. We say, like, for example, if we are buying a mobile phone, we have always seen that if it's a basic mobile phone, even the other person will actually come and ask what you are actually using a basic mobile phone. And some people tend to get caught in it, and if they buy a mobile phone which is so much of money just to show off outside that we are using it. So I have noticed that half of the patients are using today the electronic toothbrushes because they want to show that I'm highly technologically evolved human being and I want to use it. But not necessary. It is okay. Today's toothbrush, whatever we're using, a normal manual toothbrush is more than enough to clean our mouth. And I wouldn't suggest, I would say the patient, if they are having problems with muscle coordinations, or if they are special children, then automated toothbrush is better for them, not for the normal public.
Thank you, ma'am. And we see nowadays, we have a lot of options like toothpaste, tooth powders. Earlier, many people used tooth powders, and still, even now, some people prefer tooth powder. So, which would be better? Or even if both are fine, then what are the best practices that can be taken up while brushing with tooth powder and toothpaste?
Both is okay, sir. Both is okay. Tooth powder also can be used. Toothbrush, paste also can be used. Both can be used on the toothpaste. The toothpaste which is placed on the bristle, the same thing can be done. The tooth powder can be placed on the bristle of the toothbrush, and the technique in which the brushing has to be done, both is the same. So anybody's preference. They are happy with using toothpaste, great. They are happy with using tooth powder, that's also great. The only important thing is that brush and brush in the right technique. And see to it that both upper and the lower teeth, the front teeth, the back teeth, the interior part of the teeth, everything is brushed in the right manner. It's the preference of the patient whatever they are comfortable, whether it is toothpaste or tooth powder, that's their preference. That's okay.
Thank you, ma'am. You have been patiently answering all the queries. And there's one more query that children, especially, they consume a lot of toothpaste rather than brushing, they eat up. So, is there any harm if they consume excess of toothpaste daily? So, how
Uh,
do that?
That's a very good question. So always better to put a peanut size. Even adults, if we have noticed that the brushes which are there, the bristles, they put the whole toothpaste on top of that bristle. Not necessary. A peanut size is enough. And for children also put a peanut size. And yes, just tell the children that if this is not a chocolate or something where you just eat it, because there are certain ingredients which is there inside the toothpaste also. So make the child understand that these ingredients should not go inside. The children understand. It's not that they don't understand. Maybe we should tell them in such a way that no, this should not be swallowed, and don't swallow it. And accidentally, if they swallow it, that is okay. Um, and yes, the question which you asked, a lot of children in my house also, a lot of children eat toothpaste because they like the taste of it. I've noticed that they eat it because this is all flavored toothpaste which are there. It is mint taste or bubblegum taste or all these tastes are there. So that is why they swallow it. It should not cause a much of problem, but yes, we can tell the children, we can make them understand that the brushing has to be done, and just tell them that as an adult we don't swallow the toothpaste, we just throw it off, because the toothpaste which is there, we are brushing it, all the bacteria have come, and it is the toothpaste is actually taken up all the bacteria which has cleaned all the dirt which is there in the mouth, and don't swallow that dirt, but just spit it outside. But maybe if we can if we can tell them and explain to them in such a manner, then they will be able to do it.
Thank you, ma'am. This is a good idea. They will also don't want to consume any harmful bacteria or waste. So at least they
Exactly.
will spit it out.
If we tell in a manner, they will understand, because these days children are very smart, and they want to know logic. Why? I think this is the logic we can tell them. This is what the logic is, and let us spit it out rather than taking it inside the mind, inside the body.
Yeah, thank you, ma'am. And especially with this, while using these electronic brushes, ma'am, we see that some people face certain hygiene issue. So generally, how do we maintain this cleanliness of these electronic brushes?
Electronic brushes has to be changed like normally how we change our normal brushes. Every 3 months, we have to change the bristles. In the same way, electronic brushes also have to be changed. But we don't do it because it's not cost effective. How in manual brushes, in 3 months time I can buy another brush, like that in electronic, because electronic bristles are quite expensive. People don't tend to do it. The only thing we can do is little bit of hot water or warm water, just place the bristle in it for about 10-15 minutes and then remove it and brush it, or put some mouth washes inside the water. Yeah, put the bristles in that for about 1 hour. I would prefer 1 hour because there is bacterial on it. Just remove it and then again start using it. Maybe it can be done once in a week or something like that. But ideally, the bristles have to be changed every 3 months.
Thank you, ma'am. Nowadays, we are seeing, especially college students and this teenager population, they are nowadays, instead of brushing teeth, they are goggling this, mouthwash. They say even that also does the same thing, and they are following that new trend. So, how far it will maintain the hygiene, and can you just give insights on pros and cons of avoiding complete brushing and going with this mouthwash?
Uh, it is not It is so simple, sir. If we are going to take something, then why even use mouthwash? We can use normal water, no? Take water, put it inside the mouth, just gargle and tell, yeah, it is clean. That doesn't happen that way, because we need to go inside the crevices of the mouth everywhere and then mechanically remove the food particles which is there stuck inside, because the tooth is not a structure which is straight. It has curves. The tooth has curves in it, and the food will get deposited inside the curves also. The bacteria doesn't just like that, yeah, we are all straight here, and then the bacteria just sticks there. No, it is inside the crevices in the tooth, and the tooth has a structure for it. And when we do mechanical brushing only, this food particle will get removed. While gargling, not necessarily all the food particle has to come outside. It will remain inside the crevices, and the toothbrush will mechanically help to remove those food particles which is present inside the tooth. So it is always better to tell the younger generation that yes, mouthwash helps, but it doesn't help in all the situations. We have to do mechanical brushing, we have to use flosses, we have to use uh, um, mouthwash. One thing will not work. All the things together combined is what oral hygiene is all about.
Thank you, ma'am. And some, especially some, those who are, too much into hygiene, or sometimes they are too much obsessed with this hygiene. We see certain children, especially that, again, among teenagers, especially school, and and especially we found in some counseling sessions, especially girls are very much careful about their oral hygiene, about their looks, aesthetic looks of teeth and mouth area. So some are maintaining these mouthwash, and they are frequently using it. Even whatever they consume, no, immediately after that they want to use that and clean it. I don't know, somehow they caught this practice and they are using. And they are saying that yes, we are whatever we after eating anything, they are cleaning up. They said it will maintain, it will help us to maintain that. But how far this is a good practice?
It is not a good practice. It is not, because our mouth has both good bacteria and bad bacteria. We do not want to kill all the bacteria. We actually need some, because bacteria have their own good things they do also. Okay, so we have to tell them that just because you are using a mouthwash morning, afternoon, night, after eating, after consuming anything, the good bacteria which will work on cutting down food. We say that our saliva actually helps in cutting down food to make it softer, and then to add in good bacteria so that it is helped in digestion, because certain bacteria are very important for us for digesting the food. It has to break the food which is there, and these bacteria will help it. And while doing too much of brushing or too much of mouthwash, we are actually even killing those bacteria. We need it. So we can always tell them that not necessarily by using always these type of aids, it is going to be good for us. Anything excess is bad for us. Not only brushing, anything. It is in general itself, anything excess is bad. Whatever is told, like prescribed, this much of time is enough. Even toothbrush, when we are brushing the teeth, more than 2 minutes is not needed. There are people who will keep their brush inside their mouth and they will do all the household work. They'll be sitting, working, playing. They'll do everything just placing the toothbrush inside, not brushing, just placing it inside. That is also not necessary. So anything in excess is not good for health. We can tell them, we can tell them that it is not good. Anything in excess is not good for health. Yes, peer pressure is too much. These days, children get so carried away with media. They think that, okay, whatever they see in front, the TV or in the social media or anything, oh, this person is doing it, so I do it. That person is doing it, I do it. But they are not living the other person's life because the other person is getting money for it. It is not that just like that they are campaigning for so many products or something. You can tell them that good bacteria are important in our oral cavity, which helps for digestion of a lot of food, for breaking down of a lot of food. And this bacteria is needed. It's like an antiseptic for us. Certain bacteria are important. There are antibodies which are present inside the saliva, which we should not dilute. We need it, and it is very essential. And this is why we have to tell the children that don't use excess mouthwash.
Thank you, ma'am.
You can even tell this, sir, that see if our face is there, and if I keep washing in the morning and then the evening and then the afternoon and then every 1 hour, if I keep cleaning my face all the time, what happens? After some time, my skin will become dry. We think we are cleaning too much, but we need it to sweat. We need it to have some sebum. We need it to have certain things which is going to protect our face. The same way inside the mouth also, certain things are there to protect us. We can't be killing that protective barrier which is there. We can't be. It is like an army which is there inside the mouth, and these armies work for so many different things to protect us. We don't want to wash that off.
Yeah, thank you, ma'am. And certain times we see that there are certain gaps in the teeth alignment due to certain tooth get broken, and people are certain people are afraid to go to dentist and fix that, and they want to leave it as it is. So how far it is safe to leave it as it is without filling up? Will it have any adverse effect on other tooth or oral hygiene?
Yes, sir, it does. It does. The fact is that if a person has caries, that can even go to the next tooth. So it's always better to get the filling done. And if the gaps are there, too much of gaps are there, then we need it to be. See, if there is a dimension in which the tooth has to be there, and it has its functional elements to it. And if that functions are normal, then eating can be normal. See, it is every person thinks that just because the tooth is broken, it's okay, let us leave it. But they don't understand that the function goes away. Teeth is so much important for chewing, for speaking. Even if I'm speaking, suddenly if I don't have two teeth in the front and I'm speaking, what am I speaking? People don't understand who's sitting in front of me because my phonetation will change if I don't have a teeth there. Or even while chewing, I'm not able to chew the food properly, and God by Himself has given us teeth so that we chew the food properly in such a manner. We form it as a bolus, and then it goes inside the stomach. That's how it goes inside. So tooth has a lot of function. It is not only aesthetic. It's not that from outside it is seen. The if a tooth is lost, there are so many things which is lost. The speech is lost. The food the functioning is lost. You're not able to eat properly. You're not able to taste properly. You're not able to digest food properly. So it's always better to get treatment done, appropriate treatment done. Today, we might think it is just a small caries that might go into an abscess. That because of that, we might have to remove the tooth. If the tooth has to be removed, then from how will we eat? So prevention is always better. So when the problem is small, the treatment has to be done when it is small. Even economic wise, when you get the treatment done when it is smaller, then it is easier. When it goes to a surgical procedure, the costing also goes high. So it's always better to get treated when the problem is there. Yes, I understand people are scared of dentists. Yes, I understand that they say, oh, because they always associate dentists with pain. This is like, even in our culture, I've always noticed that when people are talking to children, like, oh, I will put injection, I will tell the doctor to do this to you, oh, you will have pain, all these things already, it has gone inside our subconscious mind that if a doctor, if I'm going to go, this person is going to give an injection, it is going to pain. So a lot of people associate doctors or dentists with pain. If we are able to tell them, no, the doctor will be very good to you, whatever the treatment is there, they will do it to you. A little bit of counseling is needed for these type of patients. Normally, we don't tend to do treatments at the first attempt. We tell the patient, we make them comfortable, we explain all the treatment plans to these patients, we tell them the pros and the cons, everything, and when the patient is ready, get the treatment done. But avoiding is not the answer. It's always better to go to a dentist. The fear can go. We can work on the fear element in the patient.
Thank you, ma'am. Participants, if you have any queries, you can use chat box, or you can unmute yourself, or you can raise your hand to share your observations or queries, if any. And finally, ma'am, I think we are done with the queries. And last query is definitely when it comes to medical treatment or medical fact is, the cost is, always that comes first before approaching a doctor or a hospital. So we all are worried, we consciously or subconsciously, how much it would be cost, and it is sometimes we think it's too costly to. So how, as we are talking about different modalities of treatment, so how do you suggest, ma'am? Because we have different strata of society, people of different economic status. So what would be the best strategy for all stages of income people, economic status, poor people, or how they can afford this dental care, and what would be the alternatives when they are not able to afford certain treatment or certain modality of treatment? Can you throw some insights?
Yes. In India, as such, we have so many dental government dental hospitals and dental colleges who give the best treatment for the patient. There is this small, I would say, a myth that if you go to a government hospital, you won't get the treatment the best. Nothing like that. I would say the best doctors are there in government hospitals and government sectors. They give you the right treatment. Yes, they do it. If they are not affordable, they can go to that to government hospitals or funded hospitals where the treatments are given. There are so many NGOs also work with dental teams to give treatments. This is one of the options. The second option would be uh, I would call medium-paced dentists and corporates. There are two different types of dental clinics which are there. So next to our house, a dentist will be there. He would have always been there, or he or she would have always been there as a community. As a community-based dentist, we say that if I go to a dentist, if I'm personally going to a dentist, I will go to a dentist whom I've been going from childhood. Like I have a family dentist who is there, and this family dentist will know what my know how much I will be able to afford, and will be able to tell. So like that, we can have family doctors or family dentists for ourselves. For ourselves, yes. No, I'm able. I don't have any problem with money. I'll be able to get it treated, and if they are okay, they can go to high-end dentists who are there in corporate sectors, and they can get it treated. A country like India, you have different types of for everybody. Doctors are available, and they can get their treatment done.
Yeah, thank you, ma'am, for your patience. You have so much patience, and you are the first. You came for the first time on this platform, and we are organizing since quite couple of years. And this year, as part of Azadi Ka Amrit Mahotsav, we are daily having events, webinars, seminars, conference, workshops, and we welcome you, and we really enjoyed the kind of knowledge disseminated by you and have a very good interaction with you. Thank you once again for joining us and sharing your valuable insights and inputs and answering all the queries patiently, ma'am. And we also welcome you whenever there is a feasibility. You can join our session series and enlighten us with more such information. Maybe we can create more awareness about dental health and hygiene and bring at least to certain extent address the gap between the dentistry and the common people and uh, do some myth busting as well. Thank you, ma'am. It was
Thank
happy, very insightful. And, nice to be part of this wonderful interaction and discussion. And we thank Dr. Vidya ma'am also for suggesting you and recommending you and accepting our invitation, joining this platform.
thank
And we
you,
wish
sir.
you all the success, ma'am.
Thank you, sir. Thank you, sir. Because Vidya ma'am is actually my teacher, and I have been her student from BDS, and the ma'am has always been instrumental in giving a lot of knowledge to us. And thanks a lot, sir. Thanks to ma'am and as well as you. Thank you. Thanks to everybody who are present in the platform.
Thank you, ma'am, once again. And we wish you all the success and look forward for more sessions in the future. And we extend once again our gratitude and best wishes to Dr. Vidya ma'am. He is a regular contributor on this platform. And now you are also part of this family and fraternity. We also extend our warm wishes and welcome to you. And you are always invited whenever you feel an occasion or a need for bringing an awareness, and kindly do reach us, and we will also be happy to associate you in further events, ma'am. Thank you once again on behalf of all the participants and on behalf of Sri Holistic Health Foundation India and Sri Research Institute, Center for Art, Sciences and Wellbeing, and also all our fraternity. We wish you once again happy Dentist Day, National Dentist Day. Thank you once again for joining us.
Thank you, sir. Thank you. Thank you.
Thank you, ma'am. We'll be sharing your certificate in WhatsApp in a couple of days. Thank you.
Yes, sir. Thank you. Thank you.
Dear friends, we request everyone to quickly fill up the feedback form for session 1. It will help us to prepare the certificates, because it is through which we record the attendance as well as your feedback. We have 5 minutes for the feedback. Then we will move on to our next session. Dear friends, quickly fill up the feedback form so that we can move on to our next session. Dear friends, feedback form has been raised in the form of polls. It is mandatory to fill the feedback form because it is through feedback form we get the details required, like your complete name, designation, and other details. Let's all quickly fill up the feedback form so that we can move on to next session. Dear friends, quickly fill up the feedback form. We are moving to our next session for the day by Sri Ravichandran ji. He is a principal consultant, Mapper Consulting Co. He would be presenting on planning organizing for youthful mind, HR overview. Ravichandran ji, you can minimize the poll window. Do not close it as our friends are still filling it up in the background. So you can minimize it instead of closing and you can continue with your session. So you can start your audio and video and start your presentation.
Thank you very much. How to start with my sharing screen? I'm going to the share.
You can minimize the poll window.
Yeah,
and
I minimize.
You can
already.
click on the share screen and share your PPT if it has been already opened on the desktop. Otherwise, you can open your PPT first.
Is it?
And then go to Zoom and click on share screen button.
Yeah, is viewable now? All parts. You can start. Please see it whether you can watch the screen.
Not yet.
1 minute, sir. I have kept it in the Word file.
Yeah, now it's visible.
Yeah, Word file.
The planning and organizing.
Correct, exactly.
It's visible.
Great. Dr. Well, good evening to all of you. It's a long yeah, I was unable to cope up with certain things, and due to various grounds of reason, one can keep carrying larger reasons behind for inability to manage his own commitments. Planning was got little held over, but keeping aside all those, I took almost some commits and our dignified personality, Dr. Ravindra, was all the way. I was in keeping contact with him, and splendidly he took all my statements, my communication. He was hearing it very patiently, and made me to come back and come with my own limelight of this seminar, which is going almost near into my knowledge is more than 8 months today, more than that, little larger than I think so. I search on online. I'm giving my participation program, keep going on. So I'd like to thank Dr. Ravindra once again, International, the conference on doing humanity, solidarity, governance, good governance, larger social aspects taking care of from the day one of the pre-pandemic, which we have come across, which was like a war, a third world war. We have come across. The war is actually made not by the reason of our health or the happening happen, but what the problem was, the war is happened only because of the social media networking, which made on daily basis viewing things, and naturally it's brought us to all of us a little disaster. Many of them lost many of their things in their own life. And I am very sure certain people, because of this pandemic, lost it, again got it, lost it, and again got it. Due to the pandemic, there were a loss. Due to this post-pandemic period gone through of, Again, they retrieved it. Few of them lost, few of them gained. And the few of them who gained, again they have lost. Yes, life is so cyclical. I'm very consciously want to talk in HR aspects and go with the things which always makes vulnerable to our all mindsets. How we are going to take this pinch of salt in our life hardly happened. In spite of all this and the program which is being conducted by our holistic, by Dr. Ravindra, nevertheless, it was such a tremendous involvement he has, in spite of all that were happening. So, at last, I landed up in the discussion, planning, organizing, not as a study curriculum. It is majorly on the curriculum. If I keep talking, see, I am a professor today. I'm an assistant professor in a college where I'm managing all HR relevant subjects. But when I get into this planning and organizing on the platform of the common ambience of this given seminar, webinar, is having large sets of people having their own minds, own design of developed mind, students, faculties, social services minds, NGOs, and several people come from the social interest. So I need to talk very commonly in a very small pitching way, which should make more convincing, not by 2023 is born, head to born. So coming next few days of time, we all carry with the word of manifestation in our mind, saying that, what is the new agenda for the year of 2020? Everybody keeps asking about it. We tend to talk always in all the sense that, what is your new agenda? What's your new event program for a year? After spending one night of the party, whatever the shape of happening in their own common life, they go to the topic of what is your new year agenda? Keep aside. We talk in the same fashion all the way across. What is planning? Why do we need to organize? Why should we do this? What is the purpose of it? All the life we talk all the time only about professional. What about the personal life? What about the personal life? Many of them are manifesting their involvement all the time, rushing. Rush hour, we call it by rush mean what? Crowd, huge, not crowd, sorry, rushing quickly, fast. But can we go on the road fast? Look at that, what we call it by rush hour. Every day morning FM radio says that rush hour, and this is the place you need to be careful. The traffic is diverted, the traffic is in the speed of 15 kilometer pitching. We call it by rush. How it can be a rush? It can be only a snail. We are not rushing. We all are one at particular time rushing into and trying to reach to the destination of our office or the workplace or wherever and whatnot. So, at last we call it by rush hour. Certainly, it's not a rush hour. It's a snail hour. Ama vegam, natta vegam, Tamil, I'm saying it. So imagine it, the word itself is wrong. We all are hitting at the particular time between 8 and 9:30 the morning hour, and we call it by rush hour. Actually, we can call it by either snail speed of time, tortoise speed of beach sand. Maybe that could be the right sense of my explaining on this context. Well, I'll keep going ahead on this planning organization. How can it show? What is a life? Why do we need to talk? all the way across and repeatedly, I am again repeatedly saying, planet, planet, planet. Why do we need to plan it, everything? Don't we have a life? See, the scientists spend 16 hours a day, 16 hours, 18 hours, 20 hours, just sleeping, getting up. They don't even do proper bathing, proper scientists. I know there are no college, there are institutions.
Kausalya, sorry to interrupt you. Can you
Yes,
just go to view menu and make it read mode so that the screen can look little bit bigger?
is it so? Well, screen view menu. 1 minute, sir.
You can just click on the view,
Can just
not
put on.
here, on the document itself.
Yeah, that's what I'm trying now.
At the top, you have that view option. Not in the options, on the document itself.
Yes, sir. On the document itself, that's what, yeah.
In the menu, you can see in the top file.
Yeah, 1 minute.
References. There is last option view.
One.
No, not in the Zoom options, in the Word document, in the file menu.
In the file itself, that's what.
Yeah. So you have opened up L. There you can see just above that watermark. Above that you can see the view.
My screen has got some sorts of problems. Now, is this improving?
No, you can remove all those menus on the top.
Oh,
so that's taking up some space now. So can you see that view option just above the watermark icon? Yeah. You go to the last option. Next to that and next to that. Yeah, view. Okay. Here you can
zoom. Can you zoom it?
You can click on full screen reading.
Full screen reading. Where it is? Yeah. Is this fine?
Yeah.
Now it's improved? Great, sir. Is this fine, sir?
Yes, sir.
Great, thank you. Okay. Now, where we were? See, we are more focused on certain things in all the time achieving success. We talk only the essence of success. Failure is untouchable. We consider it as an untouchable. The failure makes lot simpler and lot makes a lesson to us. This is what I have come across because the failures I have tasted several times. Several times I have tasted the failure. So I don't know whether I became a guru, a bhakta of talking of the failures. If I could have kept on succeeding, I would be giving lecture only on how to succeed. But unfortunately, I have failed more than 7, 8 in my period of time, and I could hardly succeed one. So at last, I landed up in a place where success, failure is somewhat tasteless. Either it's a bitter, either it's a sweet, or it's no savory, whatever, no formula. I find no taste of either success or failure. It's only a completion of your life went across with certain manifesting yourself to your mind to go grow up in a better manner of understanding your own lifestyle. It's all focusing on yourself. Well, sir, now I'll go. There is a plan of planning. We are planning from year 2023 giving a little refresh of the year starts on 3rd or 4th of January. We are writing a paper on the day of the January 1, writing something, a plan. The plan starts something like aside. I'll keep it aside. Now, I'll come back to one important point now. You want to get up in the morning of 4 o'clock. Let's assume you want to get up 4 o'clock, start your studies. Students, I'm talking to you. I'm the college lecturer, professor at this point of time working. I want to give you a simple study on this. You want to get up in the morning 4:30, start your studies. You put your alarm ready and made your phone or your alarm device. I don't think anybody is carrying alarm device in hand nowadays. You have your phone ready, made things perfect. 4 o'clock it will be. You kept it near to your bed. You all were grown up. Your parents cannot decide about you. If any of your parents, father, mother comes and asking, what is your plan of tomorrow? What time you are planning to study? My son used to ask, say me, hey Sriram, what time are you planning to study tomorrow? If I raise a question to him, he used to say, I was planning to start studying morning 5 o'clock. But the problem is, you ask me what is the planning of tomorrow, what time you are going to study. I already planned it 5. You ask me what time you are going to study. Now I decided not to study. You ask me a plan of me, what time you are going to study. He says that I was planned to start with the study of 5 o'clock, but now you ask me a question, what time you are planning to study. So I dropped it to start 5 o'clock. So I don't have any plan to start my study tomorrow. This way of pressure we have got into. And no, quite shocking, what to say. But if there is a plan behind of tomorrow, anybody raises a question on the plan, are you plan what tomorrow, what kind? Then they drop the plan, they want to hit you by saying that I dropped it because you asked me. This way of an amount of pressure is coming from the all channels. So you put your alarm ready, 4:30, you brought your phone nearest to your bed and were sleeping. 4:30 it was sharply ringing a bell. But you took the device, you switched it off. Again, you got into sleep because it's so chill in Chennai. You started sleeping. You know 4:30 you planned, you switched it off. Again, after 10 minutes, it's ringing. Then again, you put the device and postponed it for next 10 minutes. Again, third time also, you postponed it for next 10 minutes. Similarly, you did it 3 times, then you got irritated and you got up and you started your scheduled plan by 4:40 or 5 o'clock. Anyway, you started 30 minutes delay. No issue. 30 minutes, no, because in India, we don't care about the timing and everything keeps going on. Fine. Any meeting starts exactly at sharp time and any politician reaches to the hall on time, he is a meaningless of mind. They say that he is the imperfect, he is a waste man, he is having no any program. So time management in India is a boomerang. Nobody accepts that. Anybody comes late, that is the smartest way. They are the best, highly occupied and custodian of the clock. Well, now the decision of planning and organizing, let's organize. One, you planned it 4:30. Now you started organizing of 5 o'clock. 30 minutes last, 40 minutes last. No problem. How can we plan it now? You planned it. Now how can we organize it? One simple component, what we can do at this point of time, keep the mobile phone little away, 10 meters away, or 6 meters away. You have to get up and go there and press it off. This is the gap we have. So what we can do is, instead of keeping your mobile phone close to your heart, keep the instrument far away, maybe next room, that will be much more happy. Others will get up, everybody will get irritated. So keep the phone maybe 5 feet away, 10 feet away, let it ring. You have to get up and go and switch off. By that time, we get irritated. So this is what the planning organizing we can do somewhat in the context of simple mannerism. Good. Now, a good life plan. I want to go to my readings. Please have a look at it. Please read the paper. Since I gave you a little lecture on this, let's start with the pretty straightforward. Let's not go with the too much of agony of accepting, planning, organizing, programming, directing, controlling, coordinating. All these words are available in the management studies. All help for the professional practice, mannerism for work-life place, where you wear a white shirt and white dress code, having a tie or not, or sitting in an air-conditioned room and staring at people of the life in your life. That's all professional. But come back to the family, personal life. You look at the women, they have multiple tasks. Men is called perfection, if you call it. Women is a wholeness. Wholeness, because they have a multidisciplinary, multifunctional understanding than men. Men only can majorly focus on single-minded perfection program, maybe can achieve or may not, or may get delayed. But women, all the time across, if you look at your mother, she can do multiple tasks. My wife does it 4 different multiple tasks. I am the one man, Ravichandran, does 1 or maximum 2. I know myself. But my wife does 4, 5 different combinations. Either she succeed or not succeed, but takes multiple feather in her head, managing 2 children, managing 2 different activities, managing laptop, keeping it in the kitchen and doing it on the desktop, a laptop, on the dining table, doing something, grocery booking. I cannot go other than my workplace sitting with a neatly worn dress. I can't discuss anything in the HR concern. Even different computer screen comes in my front. I may not be in position even to talk. That kind of static minded I have. That's why I say men may perfect play with their current given one standard formula, but women is a wholeness. So this is what the gender, we have a wide difference. That is a key reason in our family itself we find larger difficulties, complications, families, conflicts. Many things come in our life. You look at your own life. So be cool. Don't plan much. Have one plan as you are a man. Women can plan maximum 2. Live a life first, rather go with your personal life, having everything planning. I given as the title of planning, I say you not to plan. This is what I'm trying to convince you. Why one should not keep doing a larger plan program. Okay, now I go to next. Sorry. Why am I not able to go for sheets? A life plan definition is simply a plan to bring about what you want to achieve in your life. It's a pretty forward. As for why life planning is important, there is infinite possibilities are always behind us. If you look at it, you plan it, that's fine. But it is not necessarily infinite. Definitely you are going to meet that. It is not like a Mission Impossible cinema cooked up story. There is a movie called Mission Impossible. That's all cooked story. Anyway, the hero is going to win it. Hero is going to win it. Mission Impossible name is okay, fine. At last, the hero is going to win it. He is going to show all his heroism with all the threads on his back of his body. So keep aside all those. It won't happen to our life having a thread on top of our head or our back of our side. And any moment comes, you can lift yourself by the director supports or the machinery supports, like fight scenes in the cinema hall. So life doesn't make all those senses to us. So that's why I want to explain, don't plan too much. Plan one and try with it, live with it as long as for the few months or only 3 months. Don't go with the plan of beyond 3 months in your personal life ambiguity. Personal life carries large senses of minds engaged. Your spouse, your children, all are different generation. Your greater side of your parents are earlier generation. 30, 30, 30 or minimum 25, 25, 25 age gap. How we all can come together, go in a den of a lion, cage of a lion or cave of a lion, all three can go together and plan for a program like a cooking of food and eating kind. Different lions, different generation in a single den, single cave. Not possible. Don't plan it like that, such a way. You plan it with a 3 months program of your personal life ambiguity, which can be easily somewhat you can reach it. Live a better life. Life plan carries with the easy planning and somewhat, don't know. If you don't have a life plan, let me tell you, assuming Ravi says that don't plan. At last, if I say again one more word, if you don't plan, what happens? Very easily end up somewhere you really don't want to go. Hope you are able to read my screen. You are able to say as such that no plan. Don't go with the plan. At last, where you will reach? Where you don't want to reach, you will reach. That's why I somewhat say that you write it down. Keep it in your heart. Keep it in your diary. Wherever you feel, even you can put as a play card at the home. You can hang it on the home mirror or on the hall. Somewhere. Something like in your mind, wherever you feel pleasing to you to reach on everyday eyesight. Do that. But without writing something in your heart, wherever, what you will do, at last you will land up somewhere in a place where you don't want to go. That's why I say you that to plan. That's it. Otherwise, planning your life is important, not just because it gets you where you want to go. And also the plan is not necessary. It's going to take you in there all the way with all the hurdles. You are not winning, the other is winning. The other is picking up the winning from you. You plan to win it, others are taken, you failed it if you feel, it's not failure. Somebody is picked up the win of yours. No, we have lot of the jargons, lot of explaining manipulated word as such. HR man does it, but no, that's why you please taste is meaningless. Keep cool, live with it, and no a 3 months program beyond. Don't do any life plan for the personal family side. Having a life plan is important. That's very important. If you don't design your own life plan, chances are you will fall into someone else's plan. Sometimes what we call it by God's designs. That's why what we say, Perumal Pratha, भगवान जी की मदद है, ठीक है, अच्छी बात है. We got something. The gods decided, you decide the God disposed. Fine, that's all fine. I accept, I admit to all those words. But you are existing. Don't feel that you don't exist, God decides. God does not dispose for your needs of 3 months plan. God is the nature. God is a coincidence. God is the circumstances. It's all the situation. Environment. God is in the environment. It's an no. He's Almighty who is on the galaxy. So we need to respect the life, nature, everything. Go with it. You don't get somebody has took from you. This is what we need to decide our mind to go. Well, quickly I'm going to the next slide and we'll finish it up by next 20 minutes. I got a plenty of time, I think so. Good. If you don't know what you want, you might get distracted by different opportunities that don't take you in the direction you really want to go. These are my sense of understanding I felt in my life, I written down. If you are not actually planning what you want, and naturally you get distracted. I'm going to talk about distraction and concentration after a few minutes of this slides on the way. I'm going to talk about it. Please, anybody want to ask immediately start with it? I will do it. Please wait. Well, as I said, you will get distracted if you don't plan it. Better you plan it, but don't put yourself into too much planner like all the time occupied in employment. All the time you say that I don't have time. All the time you say to your friends, I'm very busy with my project. You behave like a highest, smartest man in the galaxy, on the earth. I'm very busy. I have no time to take this call. I don't have time. Like an office mind. Don't be that. The person who is having a large time might be a highly matured and high potential man. This is what I believe now, after my experiences. The person who says and gives you appointment within 30 minutes, it means that he is a lavishly having a succeeded in his own life. Anybody says that I don't have time, that it means that he is in the middle of something, he is in a great trouble. Hope you may admit it, look at it so carefully, where you are standing, how you are dignified your words by saying to other people, I'm very busy, I can't do this, I can't do that. I have my project in the middle of things and that to your family, your children, your family, siblings, everybody. There is a way I have shown the big picture view. It can seem daunting to try to go from where you are now to the life that you want to lead. Though the passage is given open, but at last you are supposed to go on the same lane alone. This is what the screen appears in front of you. Big available of spaces. You can move around wherever you feel, but your road is made to go on the particular lane. This is what we are all living in our own life. If you have your both legs walking on, you can move around everywhere. But you are moving on the wheels. Naturally, you are tend to go on the given specification on the roads life. So this sense of paradigm you need to please understand. Live the better, leading, joyful life by keep your legs walking around, not by keeping your wheels all the time on road. With a life plan, you can take reaching this big, possibly scary dream life and break getting there down into bite-sized steps. Hope you could understand. All the time, if you plan it, you somewhat feel scary. Let me tell you, you plan it, you don't get in, you are getting scary. If you don't plan it, you will have drenched off, somewhere falling in. So if you have a plan, again you fall and dream. The dream is quite important in life. Without dreaming, if you live a life, and the similar dream, the same dream, sometimes, let me tell you, if there is a dream, a burning dream comes to you often and often, it means that something is going to happen the way what you feel in the dream. Somebody wants to complete their particular task, a particular education, particular commitment. It often happens, and you are visualizing yourself that you are going to reach there. I'm assuring you, the similar visual which you have come across, you will certainly achieve it. 90% success will come to you if you happen to come in the dream. Don't feel the dream is a fun. Dream is an important. Allow dream. Dream, even the daydream is a good to have. Even the 5 minutes you have the dream, yes, let the dream come. You do the little dream, do the little meditation. Any job you do is a meditation, dhyana. The job you do, dhyana. The continuity of watching TikTok, continuity of watching the YouTube, continuity of watching 5 cinemas. In your website, you developed it and downloaded and watched 4 movies, or you watched Bahubali movie 4 times continuously without giving any 5 minutes gap, because you felt that that's an entertainment for your eyes and no a visualizing interest. It itself is a dhyana, because you are more focused. You are focused on particular visual treat. Don't feel even the entertainment if you continuously play with it. It's an entertainment. It's a dhyana. Anything good do you, anything bad you do, all itself is called dhyana. So how you are going to practice to the better part, wrong part, ugly part? Ask your mind. So I'm going to complete next 10 minutes of one commitment to you. I'm going to say it. It's going to come up true. Having a life plan makes it easier and most possible to lead the life you want to live. That's what I said. Dream, dream, and dream. Quite important. Only the dream sometimes comes sudden bad dreams, good dreams. Try habituating to your good dreams by only falling into pitching of continuously 3 months of your certain commitments. So visualize it often and often before you start sleeping. Start before sleeping. Don't watch any movies before go to bed. Just dream, start sleeping, and start your sleeping with the basic dhyana. You happen to sleep, let me tell you, your sleep itself called dhyana, not sleep. Even the sleep can be considered as a dhyana. And the rituality of the Hinduism, particularly the dhyana, makes the essence of the life. People only talk about this for the past sometime 20 years, 30 years. Behind that, nobody was talking about dhyana, meditation, stress managing, criticality life, because we all fall into the technology world and carrying this technology all the way across. That is why we all talk about stress management for even kindergarten school children. Third standard girl, boy, mother is saying, he's in high stress, sir. I was not even understanding the word meaning of stress at the age of 12, 15. I'm very poor in English those times. I don't understand every English word. Stress meaning itself was not carried in my life up to 15 ages could be, or in Tamil or whatever. We were living our life. Maybe that could be the reason I could have failed 7 times, as I told in the history. But it taught me a bending upon what is good and bad. Well, do one thing, sir. If you're not sure how to plan your life, don't worry, it's so simple. Carry only one thing in your plan. 3 months, progress it, continue with it. You succeed, don't succeed, and go with it. A similar exercise, which will make your life moving plain-heartedly I'm telling you, it has to happen because our life is given with the highest morality of we need to carry that. The life is not simply, let me tell you very important, very important thing in this auditorium, please. Very important point to all of you. Keep aside of me alone. All the 15 participants, I'm going to say a very important point to you now. Keep aside me. You all are going to die. You all are going to die. Very sure. Anything irrespective of the program you are going to do it, you all are going to die. So have a fun. Understand what's the plan. How we can determine, convict ourselves. This is all the simplest form of formula in planning and organizing in the personal essence. Determining where you want to be. One thing. Planning out how you are going to get there. The first step to creating life plan is deciding what you want for your life. Life goal. Simple. Something you want to plan it. Like assuming you want to complete your not married, want to get married, not bought the house, plan to buy a house, plan to go with the family extension, plan to go with your tourism, anything irrespective of things of either leisure or personal life, professional life, everything. Don't go beyond 3 months program. See the transmission happen. How I can complete by 3 months, I can complete my MBA. Don't say that. But I want to just say you that how soon, 3 months, how progressively programmed it. Carry some skills, try reaching it. If you don't know where you want to go, then you will never get there. That's why I say plan it, happiest formula, go with it, live with your life, and values, look at yourself. Now, I'm going to complete by giving a small exercise how the distraction and concentration. We all lose our concentration somewhat. So next 10 minutes of time, I will be completing this session. Please, all the 15 participants can raise your hands and show it to our doctor. Ravindra, please look at them. All the 15 can please keep their eyes closed. All the 15 kept their eyes closed. I am going to say you some important point now. We are all given with a plan of our parents keep on saying concentrate on your study. Concentrate on your study. But did they teach you what is concentration? Is there any curriculum available? Concentration. Is there any book available exactly by your parents, teachers, faculties, your members, friends, given you a book called Concentration? I don't think so. I never got it. Maybe you could have got it. If you got it, say you raise hands. Yes, I was given with a book called Concentration. But everybody says your parents says concentrate. Did they ask you to do? How? And I'm getting distracted, sir. For what? I'm getting distraction. How to maintain concentration? Are we practiced to distraction? Are we learn distraction? First concentration, I told you how to concentrate. There is no book. There is no any exact formula available for concentration. Now the distraction. For the distraction, do we have any professional learned? How did you learn distraction? How you could not concentration? Nobody knows how to say you that how to concentrate. Okay. These all are a proper programmed our mind is called awareness. Awareness. How our mind works, you know? Our mind works on basic components of number one. Our mind works on awareness. Our mind works on anger. Our mind works on jealousy. Our mind gets connected to food, sex, happiness, joy, science, art, and few more things as per your interest. Anything it could be. But I have covered almost 7 important components: awareness, and subsequently mind, anger, jealousy, food, sex, happiness, joy, science, art, and so on. Now, these lights all the time comes in the middle of your life, so you are getting distracted. Now, I'm going to carry you, very important again, please keep your eyes closed. Please keep your eyes closed. All the participants, please do this. I'm not going to keep my eyes closed, but you all are. Number one, please sense your place of sitting. The place of sitting, please the feel of your sitting chair. Please feel the feeling of outer sound, environment, wherever, whatever, in the place of where you are. Very strict judgmentally, I'm asking you, please don't open your eyes. Look at your sense of sitting place. If you are in the middle of AC room or fan, hear the noise of the surrounding environment. Now I'm going to tell you a very important point. You are going to only hear my words. When did you go for the marriage last time? Don't keep your eyes open. I am asking you a question. Answer yourself. When did you go for the marriage last time? Did you go to the marriage with your parents? Feel it. Did you go for the marriage reception? Did you go for the marriage of 2 days or 1 day? How did you feel the food? The food you had it certainly. How did you feel the food? Is your friend married? How was the bridegroom? Is he matchable to the boy? The boy is matching to the girl. The girl is matching to the boy. Please feel it. How did you sense when you went to the marriage hall? How was the decoration? Please patiently hear the word, whatever I'm saying, but don't keep your eyes open. You lose your suspense. You felt food, the bridegroom matching. Are they suitable each other? Look-wise. How was the dress code? How were the decorations? Did you feel about that? How was the hall setups? Did you feel it? Did you find happy in the marriage you were joining? How was the dancing happen after the marriage evening reception? Did you feel it? So you completed the marriage while your eyes closed? Don't open your eyes, sir. Please come away. Please come out of it now. I'm going to give you another one event immediately, quickly completing. When did you go to the last tour program? Did you go to the tour in the last session of time? 1 year, 2 years? Please feel it. Where did you go? Was it really interesting? Was it really the travel was good? How did you go? Train? Bus? How was the season? Where did you stay? Did you feel the stay comfortable? Did you see the sightseeings are good? How was it? You visual because your eyes are closed. You know it. Everything you could call it now. Everything I could call it now. Because of my words, you are traveling now. So how was the food? How was the travel? How was the outside environment? You really enjoyed it? The tour program which you have gone through already, by closing your eyes now, you have really enjoyed it. I hope so. Whatever the form. Okay. Finish it back. Come back. Come to your back of the seat where you are sitting now. Make comfortable. Don't open your eyes. Look outside to your environment. Look outside the environment. Can you hear your computer noise? Can you hear your screen monitor, sound, screen, everything is appearing? Can open your eyes now, please. All were kept their eyes. Open your eyes. Well, thank you all of you. Now, I took you to the concentration place by keeping your eyes closed. I took all the custody of you, 15 people, enjoyed the program of one marriage, the two is a two. I took your concentration. I took your concentration of continuously 3 minutes, I'm very sure. Everything was kept off. The total custodian of your concentration, Ravi Chandran, took it. Nobody distracted you. No one has distracted you. So how did I make this concentration on you without any distraction because of you eyes closed? That's it. So your mind worked because of my word of communication reached on your ear and you did this concentration. This is the way of concentration happened. No distraction happened. So mind is the key reason what you are planning, visualizing, closing things, everything. So naturally there is no appearance of distraction. Because of the Ravi said, the word of Ravi here, I myself, you did your commitment by keeping your eyes closed and did all the functionality, whatever I said step by step. Your concentration got improved. Your awareness of your brain connected. You enjoyed it for 3 minutes continuously, where you went for the marriage, where you went for the tour program. Well, fine, happy, happy, happy. So, distraction concentration comes within our mind, within our own mindset. So let's not say I got distracted, my study got distracted, my planned program was distracted because of this, and my program was got denied because of somebody did not accept. Denial, rejection, obedience, omitting, error, everything combined in our family of life. You focus, enjoy it, go with your own visualized plan, keep your partly mind closed, live with your mind. I'm sure your involvement towards life and agony are similar. Happiness and agony are quite similar. And at last, you can live the best full life. Hope. I don't know whether Ravichandran could do it the way Ravi was communicating you. But I should also practice along with you all. I would also plan this. Thank you so much. I want to complete this session. Hope it's quite successful and tasteful measurement of your own. Thanks, Dr. Ravindra. I would like to hand over my voice connecting to you back. Thank you.
Thank you, Ravichandranji. Participants, if you have any queries, you can feel free to unmute yourself or share in chat box. And you can raise your hand or you can unmute yourself.
I hope everyone took this exercise eyes closed session carefully. If they did so, I hope they could have gone through some. It's all supposed to be conducted online. Unlucky.
So if there are no queries, then quickly fill up the feedback form for session 2. And we will be moving to our next session. Thank you, Ravichandranji, for
Thank you so much, sir. Thank you very much. All the immediate attention on me. And anybody is wanting to ask a little comment on, and please check with the people who have got really engaged in this particular online connect on the topic wherever we are spending our huge amount of energy to make people learning this process and accepting and coming ahead of their own knowledge experiences to us. Knowledge sharing is very important between every one and the other. The moment I took it, the moment I need to learn from others like you, many more of the participants, there are a lot of medical practitioners, medical social NGOs like Mary Florence. Many of them are quite dignified, communicating between, and all should know Sunil Bhosale, or Dr. Lakshmi. I'd like to thank all of individuals and behind of our support service. Thank you so much. Thank you so much.
Thank you, Ravichandranji, for a wonderful session, and we wish you all the success for your future endeavors and look forward for more sessions.
Yes, sir. Thanks very much, sir. Thanks very much, sir.
Dear participants, quickly fill up the feedback form which has been raised for session 2, and we will be moving on to our next session without taking much time by Sri Virendra Kumar Thakurji. Virendra Kumarji, you can minimize the feedback form, and you can start your audio and video and presentation after you have completed filling the feedback form. So we'll wait for another 1-2 minutes, and then we'll hand over session to you. In the meanwhile, quickly fill up the feedback form, dear friends, for session 2. You can see feedback for session 2. So our next session would be on Central Vigilance Act 2003 as amended up to 2021 by Virendra Kumar M. Thakurji. He is Assistant Professor, Computer Science Engineering, Department, and in Govind Ballapant Institute of Engineering and Technology, Uttarakhand. He is also an advocate and RTA resource person. And he is very much proactive, regularly contributing various legal awareness and other aspects in our series continuously. So we welcome you, sir, once again to our platform, and we invite you to take over for your session. You can minimize the feedback form, and you can start your audio videos.
Yes. Can you hear me, sir? Hello?
Yes, sir. It's audible, and
Yes,
I can see you also.
video. Yes, yes. Thank you, sir. Thank you so much. I hope my screen is visible, sir.
Yes, sir. Please continue.
Yes, okay. So today we shall see a very important time session, that is Central Vigilance Commission Act 2003. As per our today's theme of good governance. For good governance, a corruption-free society is required. It is my personal experience that many people don't know much about the intelligence agencies of the country. In fact, their work is somewhat secret, and so many people are not aware how these intelligence agencies work and how the country is run. So some things related to CBC, CBI, and Enforcement Directorate and Lokpal. These things we shall see under this CBC Act. There are separate acts for the CBI. It's the Delhi Special Police Establishment Act 1946. And CBI is established by a notification of Home Ministry in 1963 on 1st April. So there is no separate act for CBI as such, but technically it is called, legally it is called as DSP, Delhi Special Police Establishment. Then we have Enforcement Directorate, ED. So most of you might have heard about the name of the ED. So HERA, Foreign Exchange Regulation Act 1973, passed by the Indira Gandhi government. COFEPOSA, Conservation of Foreign Exchange and Prevention of Smuggling Activities Act 1974. SAFEMA, Smugglers and Foreign Exchange Manipulators, Forfeiture of Property Act 1976. FEMA, Foreign Exchange Manipulation Act 1999. And PMLA, Prevention of Money Laundering Act 2002. These are some of the acts that are enforced by the ED. As far as the appointments of the CBI director and ED director is concerned, so Central Vigilance Commission is given the powers for appointment of directors of CBI and ED, and that's why CVC is very important. We shall see some of the legal provisions and the amendments made in 2004. Some amendments are made in 2014 by the Lokpal Act, and the latest amendment is 2021, while the tenure of say ED directors and CBI directors is say changed, extended. So we shall see these important provisions. It is a small act, 27 sections only. So we shall see these 27 sections and the schedule. So let us see the provisions one by one. First, we see the arrangement of sections. Chapter 1 has got only 2 sections, short title and definition. Then we have the chapter 2, that is Central Vigilance Commission. In section 3, we see Constitution of Central Vigilance Commission, appointment of Central Vigilance Commissioner and Vigilance Commissioner, terms and other conditions of service of Central Vigilance Commissioner, removal of Central Vigilance Commissioner and Vigilance Commissioner, power to make rules by central government or staff. Then we see in chapter 3 the functions and powers of the Central Vigilance Commission. So we see under section 8 functions and powers of Central Vigilance Commission. 8A, is on action on preliminary inquiry in relation to public servants. 8B is on action on investigation in relation to public servants. 9 is proceedings of commission. 10 is vigilance commissioner to act as central vigilance commissioner in certain circumstances. 11 is power relating to inquiry. Section 11A is director of inquiry for making preliminary inquiry. Section 12 is proceedings before commission to judicial proceedings. In chapter 4, we have expenses and annual report. So section 13 is expenses of commission to be charged on the consolidated fund of India. Section 14 is annual report. In chapter 5, we have remaining sections. So section 14 is protection of action taken in court. 16 is about central vigilance commissioner, and staff who will be public servants. Report of any inquiry made on a reference by commission to be forwarded to that commission. 18 is power to call for information. 19 is consultation with commission in certain matters. And 20 is power to make rules. And lastly, we have 21 power to make regulations. 22 is notification rule, etc. Before parliament. 23 is power to remove difficulties. 24 is provisions relating to existing vigilance commission. 25 is appointments, etc. of officers of Directorate of Enforcement and ED. 26 is amendment of Act 25 of 1946, that is Delhi Special Police Establishment Act 1946, by which DSP or CBI is established. Section 27 is repeal and saving, and lastly is the schedule, the pro forma of oath. So let us see the preamble. This act came into being on 11 September, basically from 11 September 2003. Earlier, there was an ordinance in 1999, and that ordinance was extended from time to time and then replaced in ultimately in the year 2003, and this act was passed repealing that ordinance. The need happened because one CBI director, Mr. Alok Verma, was removed by Inder Kumar Gujral government, and it was alleged that that removal was illegal, and there should be security of tenure for CBI director at least for 2 years. And therefore, an ordinance was promulgated. There was a Vineet Narayan case before the Supreme Court of India, in which the Supreme Court gave certain guidelines. And after that, this act was passed, and CVC was given powers for appointment of, say, CBI director and ED enforcement director also. So this is an act to provide for the constitution of a Central Vigilance Commission to inquire or cause inquiries to be conducted into offences alleged to have been committed under the Prevention of Corruption Act 1988 by certain categories of public servants of the central government, corporations established by or under any central act, government companies, societies, and local authorities owned or controlled by the central government, and for matters connected therewith or incidental there. So, as per the preamble, we have to remember that the word is central, it is not national. So the word central is different from national. We have National Intelligence Agency, NIA Act of 2008. Central pertains only to the central government. It doesn't apply to state government. So the state governments are not included within the purview of Central Vigilance Commission. Even for CBI, there is section 6. There is only if the state government allows, then only the CBI can investigate, because there is the word central. So central is different from national. That you have to remember. National investigation agency, NIA, can investigate without even permission of the state government, because offences related to, say, terrorism, bomb blast, and some matters having international repercussions. For that, there is no permission of state government required. So NIA is different. So remember the difference between the words central and national. This is very important. It doesn't apply to state government employees. Now, be it enacted by Parliament in the 54th year of the Republic of India as common. So, preliminary, this act may be called the Central Vigilance Commission Act of 2003. So, there are state vigilance commissions also. They might be established under the state acts. Some states have their Lokayuktas, Upalokayuktas. So, these are different acts, and they have different powers. Some have police powers, some have the judicial powers also. So different powers are there under different acts. So this is a central act. There are only few definitions in this. So the first is, in this act, unless the contest otherwise required. Central Vigilance Commissioner is the Central Vigilance Commissioner appointed under subsection 1 of section 4. Commission is the Central Vigilance Commission constituted under subsection 1 of section 3. And Delhi Special Police Establishment is the Delhi Special Police Establishment constituted under subsection 1 of section 2 of the Delhi Special Police Establishment Act 1946. That's 25 of 1946. So the extent of CBI and CVC extends to the central government as well as all the union territories, but automatically it does not extend to the state governments. Delhi Special Police Establishment was established in 1946 because when the Britishers were about to leave the country, so they felt that once they leave the country, there could be large-scale corruption after the Second World War in India, and therefore, to contain the corruption, this DSP was established. And because of their motto of say industry that is hard work, impartiality, and integrity, the CBI got very good name and fame and say reputation because of say very high conviction rate. If you compare that with the conviction rate of state governments, conviction rate of state governments is just 6 to 7% in many states, and in case of CBI it is about 60 to 70%, almost 10 times. And therefore there is demand of CBI inquiry by the ruling party, by opposition, by press, by public, and even by judiciary. So we shall see some provisions related to this also that come within this act. And government company is the government company within the meaning of Companies Act 1956. Now we have new Act of 2013. Then Lokpal, this has been added in 2014. So Lokpal is the Lokpal established under subsection 1 of section 3 of the Lokpal and Lokayukta Act 2013. That is 1 of 2014. So Lokpal is a type of ombudsman, and for say complaints against the government related to the corruption, the Lokpal Act was established after this movement of Anna Hazare and Arvind Kejriwal. So that act has also made this change. This definition of Lokpal is included in this. The prescribed means prescribed by rules made under this act. Vigilance Commissioner means a Vigilance Commissioner appointed under subsection 1 of section 4. So there is Vigilance Commissioner, there is CVC, and there are also CVO, that is Central Vigilance Officers, that are appointed in various establishments of the central government, various departments of the central government. So there are CVOs, Central Vigilance Officers. Now we see the constitution of the Central Vigilance Commission. So there shall be constituted a body to be known as the Central Vigilance Commission to exercise the powers conferred upon and to perform the functions assigned to under this act. And the Central Vigilance Commission constituted under subsection 1 of section C of the Central Vigilance Commission Ordinance 1999. That is Ordinance 4 of 1999. I have already told that there was this ordinance and that was repealed. So ordinance was promulgated by the President of India after say Alok Verma was say removed by the Inder Kumar Gujral government, and there was demand, and even Vineet Narayan case from Supreme Court. So there was demand that there should be secure tenure for CBI directors at least for 2 years. So this CVC, which ceased to operate and continued under the government of India in the Ministry of Personnel, Public Grievances and Pensions, then Department of Personnel and Training, resolution number 331/20/99 AVD 3 dated 4th April 1999 as amended by resolution of even number dated the 13th August 2003 shall be deemed to be the commission constituted under this act. So this commission constituted under the CVC ordinance was made permanent by this act passed by the parliament. The commission shall consist of a Central Vigilance Commissioner, chairperson, and not more than 2 Vigilance Commissioners members. It is a 3-member commission like the Election Commission. Election Commission of India was earlier a single member commission. There was only election commissioner, and then during the tenure of say TN session, 2 more the election commissioners were included, and the election commissioner was elevated to chief election commissioner CEC. So similarly, here we have 3 say commissioners. One is the CVC, and there are 2 vigilance commissioners. Now the Central Vigilance Commissioner and the Vigilance Commissioner shall be appointed from amongst persons who have been or are in an all India service. EIS, there are 3 types of all India services. They have joint reporting to central as well as state government, and these are constituted under the Constitution of India. And these are IAS, Indian Administrative Service. So AIS includes IAS, IPS, and IFS, Indian Police Service and Indian Forest Service, not Foreign Service. Foreign is purely central. So Forest Service is all India service. So an all India service or in any civil service of the Union or in a civil post under the Union, having knowledge and experience in the matters relating to vigilance, policy making, and administration, including police administration. Your police service is a civil service. Civil means non-military here. So, or who have held office or are holding office in a corporation established by or under any central act or a government company owned or controlled by the central government, and persons who have expertise and experience in finance, including vigilance, including insurance and banking law, vigilance and investigation. So they could be from these corporations, provided that from amongst the Central Vigilance Commissioner and the Vigilance Commissioner, not more than 2 persons shall belong to the category of persons referred to either in Clause A or Clause B. That means there shall be at least one IAS officer or maybe IPS or IPS, and at least one person from the corporation. That all the three cannot be, say, IAS, or all the three cannot be from the corporation. The central government shall appoint a secretary to the commission on such terms and conditions as it deems fit to exercise such powers and discharge such duties as the commission may by regulation specify in this behalf. So commission is given some regulation power, and commission has notified many regulations that are available on the cvc.gov.in, that is the website of the Central Vigilance Commission. The Central Vigilance Commissioner, the other Vigilance Commissioners, and the Secretary to the Commission appointed under the Central Vigilance Commission Ordinance 1999, Ordinance 4 of 1999, or the resolution of the Government of India in the Ministry of Personnel, Public Grievances and Pensions, Department of Personnel and Training, Resolution number 371, 2019, AVD 3 dated 4th April 1999, as amended by resolution of even number dated the 13th August 2002, shall be deemed to have been appointed under this act on the same terms and conditions, including the term of office subject to which they were so appointed under the said ordinance or the resolution, as the case may be. So the CVC and the secretary that were appointed under the ordinance were made permanent by this act passed by the Parliament. For the purposes of this subsection, the expression term of office shall be construed to as the term of office with effect from the date the Central Vigilance Commissioner or any Vigilance Commissioner has entered upon his office and continued as such under this act. That means the term shall be counted from 1999. It shall not be counted afresh from 2003. That is the meaning of this. The headquarters of the commission shall be at New Delhi. Now the appointment of Central Vigilance Commissioner and Vigilance Commissioner. I have already told that CVC and CVC appoints the CBI Director and Enforcement Director. Now who appoints the CVC? So for that there is a high level committee. The Central Vigilance Commissioner and the Vigilance Commissioner shall be appointed by the President by warrant under his hand and seal, provided that every appointment under this subsection shall be made after obtaining the recommendation of a committee consisting of the Prime Minister as the chairperson, the Minister of Home Affairs as member, and the leader of the opposition in the House of the People as member. For the purposes of this subsection, the leader of the opposition in the House of the People shall, when no such leader has been so recognized, include the leader of the single largest group in opposition to the government in the House of the People, because that requires at least 10% seats, and if the second largest group does not have even 10% of the seats, then instead of the leader of the opposition, there will be the leader of the largest group, say the second largest group, that is after the ruling party. So single largest group in opposition. So no appointment of a Central Vigilance Commissioner or a Vigilance Commissioner shall be invalid merely by reason of any vacancy in the committee. So if there is any vacancy in the selection committee, then this appointment shall not be invalid. Only one appointment has been challenged so far, and PJ Thomas, Central Vigilance Commissioner. So that was removed by the Supreme Court. Visharti was removed also. So terms and other conditions of service of Central Vigilance Commissioner. So subject to the provisions of subsection 3 and 4, the Central Vigilance Commissioner shall hold office for a term of 4 years from the date on which he enters upon his office or till he attains the age of 65 years, whichever is earlier. The Central Vigilance Commissioner, on ceasing to hold the office, shall be ineligible for reappointment in the commission. That means his duration cannot be extended. He becomes ineligible, just like say there is this type of this qualification even in case of the UPSC, even the Public Service Commission under the Constitution. So member of Public Service Commission can become chairman of Public Service Commission. He can become member of UPSC, that is Union Public Service Commission member or chairman. A member of UPSC can become chairman of UPSC, and UPSC chairman cannot get any other job under the government after say retirement, because his job is to give job to others. So even there is some disqualification in case of High Court and Supreme Court judges, except where there is a provision to appoint them as chairmen of say, different commission. Subject to the provisions of subsections 3 and 4, every vigilance commissioner shall hold office for a term of 4 years from the date on which he enters upon his office or till he attains the age of 65 years, whichever is earlier, provided that every vigilance commissioner on ceasing to hold the office shall be eligible for appointment as the Central Vigilance Commissioner in the manner specified in subsection 1 of section 4. That is, a VC can become as CVC. Provided further that the term of Vigilance Commissioner, if appointed as the Central Vigilance Commissioner, shall not be more than 4 years in aggregate as the Vigilance Commissioner and the Central Vigilance Commissioner. That means the term cannot be as 4 years plus 4 years. It will be aggregate 4 years. That is, VC plus CVC, its total cannot be more than 4 years. And if it's CVC, then it cannot be more than 4 years. So that is the maximum duration, and ineligible for further appointment in the commission. The Central Vigilance Commissioner or a Vigilance Commissioner shall, before he enters upon his office, make and subscribe before the President or some other person appointed in that behalf by him an oath or affirmation according to the terms set out for the purpose in Schedule to this Act. There is only one schedule to this Act, and that is the oath. So far, the Central Vigilance Commissioner or Vigilance Commissioner may, by writing under his hand addressed to the President, resign his office. So it must be writing under his hand, that is own handwriting. It just cannot be a printed letter signed, because there could be somebody can say that that letter was there and I signed it by mistake. So letter has to be written completely in handwriting. This is say for this resignation letter. The Central Vigilance Commissioner or a Vigilance Commissioner may be removed from the office in the manner provided in section 6. So this removal procedure is given in next section. On ceasing to hold office, the Central Vigilance Commissioner and every other Vigilance Commissioner shall be ineligible for any diplomatic assignment. That means they cannot be appointed as High Commissioner or say Ambassador, appointment as Administrator of a Union Territory, and such other assignment or appointment which is required by law to be made by the President by warrant under his hand and seal. And further employment to any office of profit under the Government of India or the Government of a state. So they cannot hold any office, say, office of profit under Government of India or state government. So these are the say ineligibility after the division of office. The salary and allowances payable to and other conditions of service of the Central Vigilance Commission shall be the same as that of the Chairman of the Union Public Service Commission, that is Chairman of UPSC. Similarly, the Vigilance Commissioner shall be the same as those of a member of the UPSC, that is Union Public Service Commission. Provided that if the Central Vigilance Commissioner or any Vigilance Commissioner is at the time of his appointment in receipt of a pension other than a disability or wound pension in respect of any previous service under the Government of India or under the Government of a state, his salary in respect of the service as the Central Vigilance Commissioner or any Vigilance Commissioner shall be reduced by the amount of that pension. So pension shall be subtracted from their salary, including any portion of pension which was commuted. So if there is commutation, that is encashment of pension, even that shall be subtracted, and pension equivalent of other forms of retirement benefits, excluding pension equivalent to retirement gratuity. So gratuity is excluded, but this amount of salary shall be reduced by the amount of pension. Provided further that if the Central Vigilance Commissioner or any Vigilance Commissioner is at the time of his appointment in receipt of retirement benefits in respect of any previous service rendered in a corporation established by or under any central act or a government company owned or controlled by the central government, his salary in respect of the service as the Central Vigilance Commissioner or as the case may be the Vigilance Commissioner shall be reduced by the amount of pension equivalent to the retirement benefit. So even the say pension from corporation shall be subtracted if applicable. Provided also that the salary allowances and pension payable to, and the other conditions of service of the Central Vigilance Commissioner or any Vigilance Commissioner shall not be varied to his disadvantage after his appointment. This is so that they should be able to work say independently and without any fear or favor. Now the process of removal. So subject to the provisions of subsection 3, the Central Vigilance Commissioner or any Vigilance Commissioner shall be removed from his office only by order of the President on the ground of poor misbehavior or incapacity after the Supreme Court, on a reference made to it by the President, has on inquiry reported that the Central Vigilance Commissioner or any Vigilance Commissioner, as the case may be, ought on such ground be removed. So in case of CVC Thomas, his inquiry was conducted by Supreme Court and then he had resigned before the removal by the President. The President may suspend from office and if deemed necessary prohibit also from attending the office during inquiry the Central Vigilance Commissioner or any Vigilance Commissioner in respect of whom a reference has been made to the Supreme Court under subsection 1 until the President has passed orders on receipt of the report of the Supreme Court on such reference. The President also has the power to suspend once the report from Supreme Court is received. And notwithstanding anything contained in subsection 1, the President may by order remove from office the Central Vigilance Commissioner or any Vigilance Commissioner if the Central Vigilance Commissioner or such Vigilance Commissioner, as the case may be, is adjudged and insolvent or has been convicted of an offence which in the opinion of the central government involves moral turpitude. Moral turpitude means it doesn't include say simple offences like parking offence, etc. Or engages during his term of office in any paid employment outside the duties of his office, that is office of profit, is in the opinion of the President unfit to continue in office by reason of infirmity of mind or body, or has acquired such financial or other interest as is likely to affect prejudicially his functions as a Central Vigilance Commissioner or a Vigilance Commissioner. So these are the grounds for removal. And if the Central Vigilance Commissioner or any Vigilance Commissioner is or becomes in any way concerned or interested in any contract or agreement made by or on behalf of the Government of India, or participates in any way in the profit thereof, or in any benefit or emolument arising therefrom, otherwise than as a member and in common with the other members of an incorporated company, he shall, for the purposes of subsection 1, be deemed to be guilty of misbehavior. So there are some restrictions on his holding office of profit, even in a company. So they should not be concerned in any way with any contract or agreement made by on behalf of Government of India. Now the power to make rules by central government first half. So central government may in consultation with the commission make rules with respect to the number of members of the staff of the commission and their conditions of service. Accordingly, the central government has made rules for staff of CVC for in 2007. So that completes 2 chapters. Now we see the last 2 chapters. Functions and last 3 chapters. Functions and powers of the Central Vigilance Commission. So functions and powers of the commission shall be to exercise superintendence over the functioning of the Delhi Special Police Establishment, that is, CVC will supervise CBI insofar as it relates to the investigation of offences alleged to have been committed under the Prevention of Corruption Act 1988, that's 49 of 1988, because DSP does some other works also. So only as far as the Prevention of Corruption Act cases are concerned, PCA, or an offence with which a public servant specified in subsection 2 may, under the Code of Criminal Procedure 1973, be charged at the same trial. So only if it pertains to PCA 1988, then there will be supervision. So CBI has reporting says the it has actually changed from time to time. Sometimes it reports to the Ministry of Pensions, Public Grievances. Sometimes it reports to Ministry of this PMO. Sometimes it reports to the Parliament. So it has been changed from time to time from 1963, because there is no act of CBI as such. There is only DSP Act, and CBI name was given for the first time on 1st April 1963 by notification of the Home Ministry. Now the functions and powers of Central Vigilance Commission to give directions to the Delhi Special Police Establishment for the purposes of discharging its responsibility entrusted to it under subsection 1 of section 4 of the Delhi Special Police Establishment Act 1946, provided that while exercising the powers of superintendence under clause A or giving directions under this clause, The Commission shall not exercise powers in such a manner so as to require the Delhi police establishment to investigate or dispose of any case in a particular manner. That means they shall not be doing, say, this how to conduct investigation in a particular manner or dispose of any case in a particular manner. This type of the direction shall not be given. Inquire or cause an inquiry or investigation to be made on a reference made by the central government, wherein it is alleged that a public servant being an employee of the central government or a corporation established by or under any central act, government, company, society, and any local authority owned or controlled by that government has committed an offence under the Prevention of Corruption Act 1988, that is 49 of 1988, or an offence with which a public servant may, under the Code of Criminal Procedure 1973, that is 2 of 1974, be charged at the same trial. That means the CVC can refer the matters for investigation to the, hand over the cases to the CBI. And inquire or cause an inquiry or investigation to be made into any complaint against any official belonging to such category of officials specified in subsection 2, that is central government, wherein it is alleged that he has committed an offence under the Prevention of Corruption Act 1988 and an offence with which a public servant specified in the subsection 2 may under the CRPC be charged at the same time. And then review the process of progress of investigations conducted by the DSP into offences alleged to have been committed under the PCA 1988 or the public servant may under the CRPC 1973 be charged at the same trial. It will inquire or cause an inquiry investigation to be made. It will review the progress of investigation conducted by CBI. Review the progress of application pending with the competent authorities for sanction of prosecution under the Prevention of Corruption Act. So the government authority or the competent authority should give, say, this sanction for prosecution within 3 months. Otherwise, it is deemed that sanction for prosecution has already been given. Tender notice to the central government corporations established by or under any central act, government companies, societies, and local authorities owned or controlled by the central government on such matters as may be referred to it by that government, state government companies, societies, and local authorities owned or controlled by the central government or otherwise. So it will tender advice to these governments. And exercise superintendence or the vigilance administration of the various ministries of the central government or corporations, that is all PSUs, public sector undertaking to call them, established by or under any central act, government companies, societies, and local authorities owned or controlled by that government, provided that nothing contained in this clause shall be deemed to authorize the Commission to exercise superintendence over the vigilance administration in a manner not consistent with the directions relating to vigilance matters issued by the government, and to confer power upon the Commission to issue directions relating to any policy matters. So the CVC can't interfere into policy matters, and it cannot give say directions inconsistent with the central government. The persons referred to in clause D of subsection 1 are as follows: that is, members of All India Services serving in connection with the affairs of the Union and Group A officers of the central government, that is class 1 services. Such level of officers of the corporations established by or under any central act, government companies, societies, and other local authorities owned or controlled by the central government, as that government may, by notification in the official gazette, specify in this behalf. So if such persons are involved, then CVC has the power, provided that till such time a notification is issued under the clause, all officers of the said corporation, companies, societies, and local authorities shall be deemed to be the persons referred to in clause D of subsection 1. So in subsection 1D, we have already seen that this is subsection D, that is, inquire or cause an inquiry investigation to be made into any complaint against any official belonging to such category of official specified in subsection. So CVC is competent to say commence inquiries against these officers. That is even IAS, IPS, IFS officers and other officers. On a reference made by the Lokpal under Section 1 of Section 20 of the Lokpal and Lokayukta Act 2013, that is 1 of 2014. The persons referred to in clause D of subsection 1 shall also include members of Group B, Group C, and Group D services of the central government. It shall not be only Group A, but it could be class 2, 3, 4 also, employees of the central government. If report is made by, say, reference is made by the Lokpal. Such level of officials or staff of the corporations established by or under any central act, government companies, societies, and other local authorities owned or controlled by the central government, as that government may, by notification in the official gazette, specify in this paragraph. Provided that till such time a notification is issued under this clause, all officials or staff of the said corporations, companies, societies, and local authorities shall be deemed to be the persons referred in clause D of subsection 1. So these are the functions and powers of the CVC. Now, new section has been added to this Lokpal Act, that is in 2014, action on preliminary inquiry in relation to public servants. Generally, there are two types of proceedings, civil and criminal. So either civil proceeding may be started or criminal proceeding may be started, or both may be started, say, one after the other in any order. The purpose of civil proceeding is to find whether a person is fit to be retained in service or not, and the purpose of criminal proceeding is to find where a person is fit to be sent to jail or not. So the purposes are different, standards of proof are different, procedures are different. So let us see about this. So here, after the conclusion of the preliminary inquiry relating to corruption of public servants in belonging to Group C and Group D officials of the central government, the findings of the commission disclosed after giving an opportunity of being heard to the public servant, that is, a notice shall be given to in according to the say according to principles of national justice. A prima facie violation of conduct rules relating to corruption under the Prevention of Corruption Act 1988 by such public servant, the commission shall proceed with one or more of the following actions, namely, cause an investigation by any agency of the Delhi Special Police Establishment as the case may be. That is, it can order CBI investigation. Investigation is collection of evidence. Collection of evidence by police is called as investigation. So it is different from inquiry. Inquiry is done by the courts. Investigation is done by the police. And CBI is a type of police. Initiation of the disciplinary proceedings or any other appropriate action against the concerned public servant by the competent authority. So there could be criminal action, there could be civil action, that is disciplinary proceeding, and closure of the proceedings against the public servant and to proceed against the complainant under section 46 of the Lokpal and Lokayukt Act 2013. That is, if the complaint is found to be false, then there could be proceedings against the complainant who made a false complaint. So as per the provisions of the Lokpal and Lokayukt Act of 2013. Every preliminary inquiry referred to in subsection 1 shall ordinarily be completed within a period of 90 days and for results to be recorded in writing within a further period of 90 days from the date of receipt of the complaint. That is, within 6 months it should be completed. So this limit is specified after the 2014. Then action or investigation in relation to public servant. So in case the commission decides to proceed to investigate into the complaint under clause A of subsection 1 of section 8A, it shall direct any agency, including the DSP, to carry out the investigation as expeditiously as possible and complete the investigation within a period of 6 months from the date of its order and submit the investigation report containing its findings to the commission. That is, the CBI report shall be given to the CVC if it is related to Prevention of Corruption Act, provided that the commission may extend the said period by further period of 6 months for the results to be recorded in writing, so that such cases are dealt with expeditiously by the CBI. Now, notwithstanding anything contained in section 173 of the CRPC, that is final report, charge sheet, any agency, including the DSP, shall, in respect of cases referred to by the commission, submit the investigation report to the commission. So this has overriding effect over charge sheet of the 173. Instead of trial court, it will submit the charge sheet to the CVC instead of the trial court. The commission shall consider every report received by under subsection 2 from any agency, including the DSP, and may decide as to file charge sheet or closure report before the special court against the public servant. So there are special courts. We call these special courts as CBI courts. That is, CBI is a police. It is a branch of the executive. CBI special court is a branch of the judiciary. So CBI is different from CBI court. So under CRPC, they are called as special courts. That is, those who deal with only CBI cases. To initiate the departmental proceedings or any other appropriate action against the concerned public servant by the competent authority. That means they can send the case for trial to the special court, and they can even initiate the departmental proceedings. That is criminal as well as civil proceedings. Now the proceedings of commission. So proceedings of the commission shall be conducted at its headquarters, that is Delhi. The commission may by unanimous decision regulate the procedure or transaction of its business as also allocation of its business amongst the Central Vigilance Commissioner and other vigilance commissioners. So that is generally done by the CVC. Save as provided in subsection 2, all business of the commission shall, as far as possible, be transacted unanimously. That means there is it shall be unanimously, but there could also be work division done by the CVC, and subject to the provisions of subsection 3, if Central Vigilance Commissioner and other vigilance commissioners differ in opinion on any matter, such matter shall be decided according to the opinion of the majority. So there would be voting because there are 3 persons, and there could be say 2-1 division or 1-2 division. So it will be as per the opinion of the majority, that is, there could be either unanimous decision or there could be 2-1 decision. The Central Vigilance Commissioner, or if for any reason he is unable to attend any meeting of the commission, the senior most vigilance commissioner, commissioner present at the meeting shall preside at the meeting. So either the CVC or if he is absent, then say senior most vigilance commissioner. No act or proceeding of the commission shall be invalid merely by reason of any vacancy or any defect in the constitution of the commission. That means there could be 3, 2, or 1 members in the commission. Any defect in the appointment of a person acting as the Central Vigilance Commissioner or as a Vigilance Commissioner, or any irregularity in the procedure of the commission not affecting the merits of the case. So this proceeding shall not be invalidated because of this reason. The Vigilance Commissioner to act as Central Vigilance Commissioner in certain circumstances. So in the event of the occurrence of any vacancy in the office of the Central Vigilance Commissioner by reason of his death, resignation, or otherwise, the President may, by notification, authorize one of the Vigilance Commissioners to act as the Central Vigilance Commissioner until the appointment of a new Central Vigilance Commissioner to fill such vacancy. And when the Central Vigilance Commissioner is unable to discharge their functions, owing to absence on leave or otherwise, such one of the Vigilance Commissioner, as the President may by notification authorize in this behalf, shall discharge the functions of the Central Vigilance Commissioner until the date on which the Central Vigilance Commissioner resumes his duty. So this is effect of the death, resignation, and leave or absence. Their power relating to inquiries. So the commission shall, while conducting any inquiry referred to in clause B or C, B and C of subsection 1 of section 8, have all the powers of a civil court, trying a suit under the Code of Civil Procedure 1908, and in particular in respect of the following matters, namely summoning and enforcing the attendance of any person from any part of India and examining him on oath, requiring the discovery and production of any document, receiving evidence on affidavit, requisitioning any public record or copy thereof from any court or office, and issuing some commissions for the examination of witnesses or other statements, documents, and any other matter which may be prescribed. So CVC, this commission has the powers of a civil court as far as these matters are concerned. Then there is provision for Director of Inquiry. This was inserted in 2014 by Lokayukta and Lokpal Act of 2013. So there is Director of Inquiry for making preliminary inquiry. So there shall be a Director of Inquiry, not below the rank of Joint Secretary to the Government of India, who shall be appointed by the central government for conducting preliminary inquiries referred to the commission by the Lokpal. And the central government shall provide the Director of Inquiry such officers and employees as may be required for the discharge of his functions under this Act. So there is separate Director of Inquiry, say, after this amendment since 2014. Now proceeding before commission to be judicial court, since there are powers of say court. So the commission shall be deemed to be civil court for the purposes of section say 195 and chapter 26 of the Code of Criminal Procedure 1973, and every proceeding before the commission shall be deemed to be a judicial proceeding within the meaning of section 193 and 228, and for the purposes of section 196 of the Indian Penal Code. That is 196 fabrication of evidence. So for that there is punishment under IPC, and 228 intentional insult. That means if someone comes and somebody doesn't go, there could be IPC offense under 228. So these are powers as per this say section 195 and chapter 26 of the CRPC. That is offense against public justice. So they have these powers, and this proceeding shall be judicial court. Now we come to chapter 4. There are 2 sections in this. So expenses and annual report. So expenses of commission to be charged on the consolidated fund of India. So the expenses of the commission, including any salaries, allowances and pensions payable to or in respect of the Central Vigilance Commission, the Vigilance Commission Secretary and the staff of the commission shall be charged on the consolidated front office. And then annual report. So it shall be a duty of the commission to present annually to the president a report as to the work done by the commission within 6 months of the close of the year under report. That is for preceding year, the report shall be submitted within next 6 months. The report referred to in subsection 1 shall contain a separate part on the functioning of the Delhi Special Police Establishment so far as it relates to subsection 1 of section 4 of the Delhi Special Police Establishment Act 1946. That is, there will be a separate section on working of CBI in that report. On receipt of such report, the president shall cause the same to be laid before each house of parliament. So CBI for the purpose of this offences under prevention of corruption and reports to the CVC. And the last chapter, miscellaneous. So protection of action taken in good faith. So no suit, prosecution or any or other legal proceeding shall lie against the commission, the Central Vigilance Commissioner, any vigilance commissioner, the secretary, or against any staff of the commission in respect of anything which is in good faith done or intended to be done under this act. So there cannot be any civil or criminal or say other legal proceeding for taking any action under this act. Then Central Vigilance Commissioner and staff to be public servants. That is, they themselves can be prosecuted under IPC if they are corrupt. So Central Vigilance Commissioner, every Vigilance Commissioner, the secretary and every staff of the commission shall be deemed to be a public servant within the meaning of section 21 of the Indian Penal Code. That is liable to be prosecuted as public servant if there is an offence. A report of any inquiry made on reference by commission to be forwarded to that commission. So the report of the inquiry undertaken by an agency on a reference made by the commission shall be forwarded to the commission. The commission shall, on receipt of such report and after taking into consideration any other factors relevant thereto, advise the central government and corporations established by or under any central act, government companies, societies, and local authorities owned or controlled by that government as the case may be as to the further course of action. So this report will be there, and the commission shall say advise the central government or its agency. The central government and the corporations established by or under any central act, government companies, societies, and other local authorities owned or controlled by that government as the case may be, shall consider the advice of the commission and take appropriate action. They will have to consider the advice and take appropriate action, provided where the central government, any corporation established by or under any central act, government company, society, or local authority owned or controlled by the central government, as the case may be, does not agree with the advice of the commission, it shall, for reasons to be recorded in writing, communicate the same to the commission. That is, if it does not agree, then reasons have to be given in writing and communication has to be made. It cannot just sit over the report without taking any action. The power to call for information. So the commission may call for reports, returns, and statements from the central government or corporations established by or under any central act, government companies, societies, and other local authorities owned or controlled by that government, so as to enable it to exercise general supervision over the vigilance and anti-corruption work in that government and in the said corporations, government companies, societies, and local authorities. So it will call for information, and it will also exercise general supervision over the vigilance and anti-corruption work. For this purpose, there are CVO, that is Central Vigilance Officer, appointed in the central government and its agency. And consultation with commission in certain matters. So central government shall, making any rules or regulations governing the vigilance or disciplinary matters relating to persons appointed by public services and posts in connection with the affairs of the union or to members of the All India services, consult the commission. That is, persons belonging to this All India services where there is joint reporting, that is IAS, IPS, and IFS. So at that time, the commission shall be consulted. Similarly, for removal also, there shall be a consultation with the Union Public Service Commission also for removal. So UPSC doesn't only appoint IAS or IPS and IFS officers; it also does the job of the task of removing those officers from IAS, IPS, or IFS as per the constitutional provision. The power to make rules. So central government may, by notification in the official gazette, make rules for the purpose of carrying out the provisions of this act. So this is the rule making power. There are only three heads under which the powers this rule can be made. In particular, and without prejudice to the generality of the foregoing power, such rules may provide for all or any of the following matters, namely the number of members of the staff and their conditions of service under Section 7. Accordingly, the rules have been made in 2007 by the central government. any other power of the civil code to be prescribed under clause F of section 11. So these power may be say changed or increased, and any other matter which is required to be or may be prescribed. Then power to make regulations. Now the commission can frame its own regulation for regulating its own procedure. So Act has got higher authority than rules, and regulations have got lower authority as compared to rules. So the hierarchy is first there is constitution, then Act, then rules, then regulations, then notifications, then government order, and lastly the office order. So that is the hierarchy as far as the interpretation of different statutes or the administrative law is concerned. So commission may, with the previous approval of the central government by notification in the official gazette, make regulations not inconsistent with this Act, and the rules made thereunder to provide for all matters for which provision is expedient for the purposes of giving effect to the provisions of this Act. So commission can make its regulation, and for what purpose, that is given here. So in particular, and without prejudice to the generality of the foregoing powers, such regulations may provide for any or say for all or any of the following matters, namely the duties and powers of the secretary under subsection 4 of section 3, and the procedure to be followed by the commission under subsection 2 of section 9. Now notification, rule, etc. to be laid before Parliament. So every notification issued under clause B of subsection 2 of section 8, and any rule, every rule made by the central government, and every regulation made by the commission under this Act shall be laid as soon as may be after it is issued or made before each house of Parliament while it is in session for a total period of 30 days, which may be comprised in one session or in 2 or more successive sessions, and if before the expiry of the session, immediately following the session or the successive sessions aforesaid, both houses agree in making any modification in the notification or the rule or the regulation, or both houses agree that the notification or the rule or the regulation should not be made, the notification or the rule or the regulation shall thereafter have effect only in such modified form or be of no effect as the case may be. So, however, that any such modification or annulment shall be without prejudice to the validity of anything previously done under that notification or rule or regulation. That is, when this notification, rules, regulations are made, they will be laid before the Parliament, and if already something is done, then it cannot be undone by the Parliament. So, but it can modify, or it can say give effect to it, or it can not. It may not give effect to it. Then power to remove difficulties. So this is just temporary or transitory provision. So if any difficulty arises in giving effect to the provisions of this Act, the central government may, by order not inconsistent with the provisions of this Act, remove the difficulty, provided that no such order shall be made after the expiry of a period of 2 years from the date of commencement of this Act. And every order made under this section shall, as soon as may be after it is made, be laid before each house of Parliament. And after 2 years, the only the remedy is to amend the Act by bringing amendment in the Parliament. The provisions relating to existing Vigilance Commission. So there was Vigilance Commission established in 1999 by the ordinance in 1964 also. So with effect from the constitution of the commission under subsection 1 of section 3, the Central Vigilance Commission set up by the resolution of the Government of India and the Ministry of Home Affairs number 24764 AVD dated the 11th February 1964. So there was this commission also earlier, which was working before this ordinance of 1999. Herein after referred to in this section as the existing Vigilance Commission shall, insofar as its functions are not inconsistent with the provisions of this Act, continue to discharge their said function, and all actions and decisions taken by the Vigilance Commission, insofar as such actions and decisions are relatable to the functions of the Commission constituted under this Act, shall be deemed to have been taken by the Commission. So earlier, this Commission was functioning without the Act, just by notification of the Home Ministry, and in 2003, the Act was passed by the Parliament. In case of CBI, one such Act was drafted in 2010 by the Manmohan Singh government, but that has not yet come into being because the CBI does not have its own Act except this old Act of Delhi Special Police Establishment Act 1946. All proceedings pending before the Vigilance Commission, so far as such proceedings relate to the functions of the Commission, shall be deemed to be transferred to the Commission and shall be dealt with in accordance with the provisions of this Act. That is, the existing Commission of 1964 is a reconstituted or say made as per this Act. The employees of the Vigilance Commission shall be deemed to have become the employees of the Commission on the same terms and conditions. That means even the employment got transferred automatically, and all the assets and liabilities. That means all the say finances, court cases of the Vigilance Commission shall be transferred to the Commission. Then appointment, etc. of officers of Directorate of Enforcement. This is very important section. What is the interaction between say CVC and Enforcement Directorate, ED? So, notwithstanding anything contained in the Foreign Exchange Management Act FEMA 1999, it has repealed the FERA of 1973 of Indira Gandhi government, or any other law for the time being in force. FERA was considered stricter. FEMA is somewhat mild as compared to the FERA of 1973. The foreign exchange violations are very destructive for the country, and this result in a large-scale poverty in the country. Even Adolf Hitler, the Chancellor of Germany, was against such violation. And during the Second World War, that is from 1939 to 1945, his Gestapo, that is the people, his spies, they overheard the conversation of many, bank employees in Swiss bank. Switzerland is nearer to Germany, and they detected there were thousands of bank accounts of German citizens, and then he asked the Swiss government to transfer all this money to Germany. Else, Germany would go on war with the Switzerland. So that was around Second World War. Because this foreign exchange violation has many destructive effects on the entire economy of the country. So there is an enforcement directorate that enforces this FEMA. So the committee, the central government shall appoint a director of enforcement in the Directorate of Enforcement in the Ministry of Finance on the recommendations of the committee consisting of the Central Vigilance Commission as chairperson, Vigilance Commissioners as members, Secretary to the Government of India in charge of the Ministry of Home Affairs in the central government as member, and Secretary to the Government of India in charge of the Ministry of Personnel in the central government as member, and Secretary to the Government of India in charge of the Department of Revenue, Ministry of Finance in the central government as member. That is, there is CVC, there are 2 VCs, 3 members, and Secretary, that is the 4th member, Secretary Home, Secretary Personnel, and Secretary Revenue, Ministry of Finance. So these are the 6 persons as members. While making a recommendation, the committee shall take into consideration the integrity and experience of the officers eligible for appointment. And no person below the rank of additional, now this as far as the CVC was removed, Thomas, there were certain allegations that the inquiry is going on against him, and then he was made CVC. So Supreme Court went into that, and then he was removed. While making a recommendation, the committee shall take into the appointment was set aside by the Supreme Court. The committee shall take into consideration the integrity and experience of the officers eligible for appointment. This is for the ED. No person below the rank of additional secretary to the Government of India shall be eligible for appointment as a Director of Enforcement, and a Director of Enforcement shall continue to hold office for a period of not less than 2 years from the date on which he assumes office. That minimum security of 2-year tenure is given as per the recommendation of the Supreme Court in Vinit Narayan case for ED and CBI directors. So this is so the security of tenure is given. Now there is this amendment made, which has been challenged before the Supreme Court now at present. So when Sanjay Kumar Mishra, Enforcement Directorate, was given extension by the central government, so provided that the period for which the Director of Enforcement hold the office on his initial appointment may, in public interest, on the recommendation of the committee under Clause A, and for the results to be recorded in writing, be extended up to 1 year at a time. So the extension of 1 year was given, and that is under consideration before the the Supreme Court at present. So this amendment made in 2021 has been challenged as unconstitutional and the violative of this CVC Act. So provided further that no such extension shall be granted after the completion of a period of 5 years in total, including the period mentioned in the initial appointment. So it cannot be more, in total it cannot be more than 5 years in total, including the initial appointment. A Director of Enforcement shall not be transferred except with the previous consent of the committee referred to in Clause A. That is, even the transfer cannot be done. The committee referred to in Clause A shall, in consultation with the Director of Enforcement, recommend officers for appointment to the post above the level of Deputy Director of Enforcement, and also recommend the extension or curtailment of the tenure of such officers in the Directorate of Enforcement. That is, even the Deputy Director. So in all zones, in India, there are deputy directors of enforcement. Below that, there are additional assistant directors of enforcement as per the provisions of the FERA 1973 and FEMA 1999. On receipt of the recommendation under clause F, the central government shall pass such orders as it thinks fit to give effect to the state recommendation. Now, what are the changes made to the TSP Act and by which the CPI has been established? So, the CVC Act 2003, Section 26 has made these changes in CPI Act. That is the, we call it TSP Act actually. So, after Section 1, the following section shall be inserted, namely interpretation section. So, words and expressions used herein and not defined but defined in the Central Vigilance Commission Act 2003 shall have the meaning respectively assigned to them in that act. So, this is the definition or interpretation. Now for section 4, the following sections shall be substituted. That is superintendence and administration of special police establishment. So the superintendence of the Delhi Special Police Establishment, in so far as it relates to the investigation of offences alleged to have been committed under the Prevention of Corruption Act 1988, shall vest in the commission. Save as otherwise provided in subsection 1, the superintendence of the state police establishment in all other matters shall vest in the central government. See, there is joint reporting. For PCA matters, it refers to the commission. For other matters, it refers to the central government. That is maybe PMO or the Ministry of say, Pensions and Public Grievances, Ministry of Personnel, Pensions and Public Grievances. The administration of the state police establishment shall vest in an officer appointed in this behalf by the central government, herein after referred to as the director, who shall exercise in respect of that police establishment such of the powers exercisable by an inspector general of police in respect of the office, police force in a state as the central government may specify in this behalf. So there will be a CBI director, and he has the powers similar to that of the say IG, Inspector General of Police, under the Police Act 1861. Then committee for appointment of director. So this committee appoints the CBI director. So central government shall appoint the director on the recommendation of the committee consisting of the Central Vigilance Commissioner, chairperson, Vigilance Commissioners as members, Secretary to the Government of India in charge of the Ministry of Home Affairs in the central government as member, and Secretary Coordination and Public Grievances in the Cabinet Secretariat as member. The raw works under the Cabinet Secretariat, that is Research and Analysis Wing, that is the spies of India who work in other countries. Within country are Intelligence Bureau, so that comes under Home Ministry. A raw comes under Cabinet Secretariat, and this is the 5-member committee, that is 1 CVC, 2 VCs, and Home Secretary and Secretary Coordination and Public Grievances. This committee appoints the CBI director. While making any recommendation under subsection 1, the committee shall take into consideration the views of the outgoing director. This is also necessary, that views of outgoing director are taken into consideration. The committee shall recommend a panel of officers on the basis of seniority, integrity, and experience in the investigation of anti-corruption cases, and chosen from amongst officers belonging to the Indian Police Service, that is IPS, constituted under the All India Services Act 1951, that is IPS officers, for being considered for appointment as the director. The terms and conditions of service of director. Again, this section has been inserted in 2003 in the DSP Act 1946. The director shall, notwithstanding anything to the contrary contained in the rules referring to the conditions of service, continue to hold office for a period of not less than 2 years from the date on which he assumes office. That is, minimum 2 years, say tenure is ensured for the CBI director, just like the enforcement director, as per the recommendations of the Supreme Court in Vidin Narayan case, when the Alok Verma was removed by the Inder Kumar Gujral government before completing his tenure. The director shall not be transferred except with the previous consent of the committee referred to in subsection 1 of section 4A. So even the transfer cannot be done without recommendation of this committee. And appointment of for posts of superintendent of police and above, extension and curtailment of the tenure, etc. That is SPs of CBI. All the say states have SPs. Some states even have officers of DIG rank, DIG of CBI. So committee referred to in subsection 4A shall, after consulting the director, recommend officers for appointment to the posts of the level of superintendent of police and above, and also recommend the extension or curtailment of the tenure of such officers in the TSP. And on receipt of the recommendations under subsection 1, the central government shall pass such order as it thinks fit to give effect to the state recommendation. So for SP and above, these all appointments are done by the CVC, by that committee mentioned. And then there is this another amendment to this DSP Act of 1946, So after section 6, the following section shall be inserted, namely section 6A. Approval of central government to conduct inquiry or investigation. So the DSP shall not conduct any inquiry or investigation into any offence alleged to have been committed under the Prevention of Corruption Act 1988, except with the previous approval of the central government, where such allegation relates to the employees of the central government of the level of joint secretary and above, and such officers as are appointed by the central government in cooperation in corporations established by or under any central act, government companies, societies, and local authorities owned or controlled by that government. So for officers of state government, the approval of the state government is necessary as per section 6. And as per section 6A, approval of central government is required as per as the officers above joint secretary and above ranks are concerned. And notwithstanding anything contained in subsection 1, no such approval shall be necessary for cases involving arrest of a person on the spot on the charge of accepting or attempting to accept any gratification other than legal remuneration. Referred to in clause C of the explanation to section 7 of the Prevention of Corruption Act 1988. Means what we call as called red-handed. That is, if somebody accepted taking bribe, then sanction for prosecution is not necessary. Without sanction directly, he can be prosecuted in the court. Now the repeal and saving, the last section. So the government of India, in the Ministry of Personnel, Public Grievances and Pensions, that is Department of Personnel and Training, resolution number 371/2099 AVD3, dated the 4th April 1999, as amended by resolution of UN number dated the 13th August 2002, is hereby repealed. So this earlier it was through this resolution that is repealed after this act, and notwithstanding such repeal and the cessation of operation of the Central Vigilance Commission Ordinance 1999, that is Ordinance 4 of 1999, anything done or any action taken under the said resolution and the said ordinance, including the appointment made and other actions taken, or anything done or any action taken or any appointment made under the DSP Act 1946 and the FERA 1973, as amended by the said ordinance, shall be deemed to have been made or done or taken under the Act or the DSP Act 1946 and the FEMA Act 1973, as if the amendments made in those acts by this act were in force at all material times. So there is this repeal, and there is also saving that it shall not operate, say, with a retrospective effect or backdated. And lastly, we have the schedule. This is a form of oath. The form of oath or affirmation to be made by the Central Vigilance Commissioner or Vigilance Commissioner, that I, AB, having been appointed Central Vigilance Commissioner or Vigilance Commissioner of the Central Vigilance Commission, do swear in the name of God or solemnly affirm that I will bear true faith and allegiance to the Constitution of India as by law established, that I will uphold the sovereignty and integrity of India, that I will duly and faithfully and to the best of my ability, knowledge and judgment perform the duties of my office without fear or favor, attraction, affection or ill will, and that I will uphold the Constitution and the law. So this is the schedule that completes this presentation. Any questions on this, or any questions in general about CVC, CBI, Enforcement Directorate?
Thank you, Virendra Kumarji. It was a very insightful presentation.
Thank you, sir.
And you gave insights into a lot of vigilance departments and how in the background various anti-corruption services and service personnel work. Very insightful. Participants, if you have any queries, you can feel free to ask, unmute yourself.
Yes, any questions? Thankful to Dr. Ravindra and thankful to the Holistic Health Foundation of India and CKSW for giving me this opportunity to make presentation on Central Vigilance Commission Act 2003 as amended up to 2021. I'm also thankful to all the participants for their patient listen. If there are any questions, I'll be glad to answer those questions.
So thank you, Virendra Kumarji, for joining us and very insightful session. And we wish you all the success and look forward for more sessions in future.
Thank you, sir. Thank you so much.
So I think that's for the day, and so we will not take much time ahead. And kindly fill up the final feedback form. So with this, we shall conclude the conference, and we thank everyone for joining us on this wonderful day. And see you all tomorrow at 6 o'clock. And once again, happy Tulsi Puja Day and happy Good Governance Day. And also happy Christmas to all our Christian friends. So kindly fill up the overall feedback form before you leave the conference. And we thank each and everyone, especially the speakers for the day, Dr. Sonali Sarkar and Ravichandran ji and Virendra Kumar ji and all others who have immensely contributed to this conference. We know that everything is related to sustainable development, and it is very much apt to discuss various issues. And in the coming days also, we will try to include various topics. And we have changed a little bit, modified the policy of, regarding the presenters and speakers. So feel free to approach us to carry out the sessions, and from January onwards, the sessions are open till August 2023. So whoever would like to make a presentation, so you can approach us and book your slot any of your convenient day. So you can make as many presentations as you would like to and share, contribute your immense knowledge in your domain expertise. So we invite all the subject experts to be part of daily webinars and weekly conferences. And let's all together keep sharing knowledge and keep learning and gaining insights. So as on this day, we are celebrating Good Governance Day, also known as Susashan Divas. Nation remembers our beloved Prime Minister and Bharat Ratna, Sri Atal Bihari Vajpayee ji, on his birth anniversary. The government has designated Good Governance Day as a working day today, in keeping with this philosophy. And knowing the special days, especially marking the India's rich past, is critical for our, ancient history or insights about various personalities. And Good Governance Day aims to increase Indian citizens' knowledge of government's accountability. On December 23, 2014, on former Prime Minister Atal Bihari Vajpayee ji and Pandit Madan Mohan Malaviya were awarded the highest civilian honor in the country, the Bharat Ratna. Following the declaration, Narendra Modi ji, the then newly elected Prime Minister of India, declared 25th Good Governance Day. So it is a very important day for all of us, for a transparent, accountable government and services. Governance is a process of making decisions and putting those decisions into action, like cooperation between international, national, and local governance. And India's first District Good Governance Index was launched by our Union Home Minister Amit Shah ji as a pilot District Good Governance Index, a governance performance SOP, standard operating procedures, and it will be rolled out for every district in the entire nation, though still it has to be initially for Jammu and Kashmir. It was initiated and has 58 governance performance indicators, 116 data points spanning 10 governance sectors. And there are also 8 indicators of good governance as determined by the United Nations. That is participation, the constitutional rule of law, transparency, responsiveness, orientation of agreement, equity, efficacy and effectiveness, accountability. So people should participate. There are 8 indicate participation. People should participate in decision making directly or through appropriate intermediary entities representing their interests. The constitutional rule of law, legal frameworks, notably human rights law, should be fairly and impartially enforced. And transparency is built on the open flow of information. Individuals interested in processes, institutions, or information have direct access to them, providing adequate information to understand and monitor them. Responsiveness, institutions and process strive to provide timely service to all stakeholders. Orientation of agreement, good governance necessitates the mediation of many societal interests to create a broad consensus to the best interest of the entire community. And how to achieve this? Equity, all people, especially the most vulnerable, can improve or preserve their health. Efficacy and effectiveness, processes and institutions provide outcomes that meet demands while maximizing resource utilization. Accountability, the public as well as the institutional stakeholders hold decision makers in government, the commercial sector, and the civil society organizations accountable. And there are also various challenges to good governance. Women's empowerment. Women are underrepresented in government institutions and other related industries. Corruption. India's high level of corruption is commonly regarded as a significant impediment to improving government quality. And this is also the people mindset that is promoting this corruption at various stages. So irrespective of that, we as citizens of nation should take accountable for a corruption free, and we should not in any way contribute or promote corruption in the nation. And hindrance to exercise the right to prompt justice. A person has a right to prompt justice, yet various factors prevent the average person from exercising it. One of these factors is the court's personnel and the logistical deficiency and administrative system centralization. Lower level governments can only function effectively if given authority. So this is especially important for Panchayat Raj institutions, in short known as PRIs, which are now suffering from lack of funding and functionaries to carry out their legally mandated responsibilities. And politics as a criminal offense. The criminalization of politics as well as the unholy alliance of politicians, civil servants, and commercial interests is harming policy making and governance. Environmental security and long-term development are often used interchangeably, which is problematic. Globalization, liberalization, and the market economy present challenges. So there are various initiatives taken by the government of India concerning good governance. We'll just quote few. The Good Governance Index, GGI, which was created by the Ministry of Public Personnel, Public Grievances and Pensions to assess the country's governance. It evaluates the impact of various initiatives undertaken by the state and local governments. And National E-Government Strategy, the organization mission states that make all government services accessible to the common person in their locality through common service delivery outlets and ensure efficiency, transparency, and the organization vision reads reliability of such services at low cost to realize the basic demands of a common man. And the 2005 Right to Information Act plays an important role in promoting governance, transparency, and accountability. Other initiatives include the establishment of Niti Aayog, the Make in India program, the Lokpal Bill, and many others. So good governance has 8 characteristics: participation, responsiveness, equity, accountability, efficacy and effectiveness, and the constitutional rule of law, transparency, and the orientation of agreement. And accountability is essential in order to maintain the law and order in a country and pave way towards a successful democracy, rather than a cooperation for dictatorship. And this day, National Good Governance Day, acts like a reminder for the government, for them to be unbiased, responsible, transparent government that only aims towards the holistic development of the nation and its citizens. And this year, the theme for the Good Governance Day, Prashasan Gaon Ki Aur, by conducting nationwide campaigns to facilitate the redressal of the grievance to the public and the district, villages, states, union territories, etc., shall be given ample importance and support the system in all nooks and corners of the society. It aims at the reformation of the society through the proper intervention by the government bodies in the decision making and formulation. So with this, we shall briefly conclude the commemoration for the day and see you all tomorrow. Hope you all had filled the feedback form. If not, quickly fill up the feedback form.